Good evening, everyone. Welcome to the City of Palm Coast City Council Business Meeting. Today is Tuesday, June 2nd, 2026. It's approximately 6 p.m. We're in the John Netz Community Wing of City Hall. I'm calling this meeting to order. If you could, please stand with me for the Pledge of Allegiance and a short moment of silence. If you have devices, please silence them at this time. Thank you so very much. Please be seated. Ms. Cook, if you could call the roll.
Mayor Norris.
Here.
Vice Mayor Pontieri.
Present.
Councilmember Gambaro.
Here.
Councilmember Miller.
Here.
Councilmember Sullivan.
Here.
All members are present.
Thank you, ma'am. We're going to begin today's proceedings with a presentation concerning My Health On-Site Clinic. Do we have the presenters available? Yes, sir. Ms. Fuller and crew will come up with you.
Good evening, Mayor, City Council, Renina Fuller, Director of Human Resources. We have Lisa Lynch here, who's our HR manager. In March, Council received a presentation from Brian Branham. He's an account exec with My Health On Site. During the May 12th workshop, Council requested that staff return with a 5-year projected cost and savings analysis for the city, along with a 5-year historical review of the county's cost and savings. Today, Brian's here with us to review your request.
Thank you, ma'am.
Thank you. Appreciate the opportunity to be here.
Yes, sir.
So we can start with, if you have the PowerPoint, there we go. Thank you so much. What I did is put together, first off, again, my name is Brian Branham, Vice President with My Health On Site, and we have been operating the health center at Flagler County now since 2011. So it's been an honor to serve the employees and members of the county. And thank you for, again, looking at this. And we'll talk about the county first, and then I can go over any questions you have regarding the projections for the city. So what I did, I went back. These are reviewed annual reviews that we've had with the county, with the exception of 2025. We're getting ready to do that tomorrow. But I did include it. So we went back to 2020-21, and what we do is, and we kind of reviewed this more in depth in the previous time I was here. We kind of went through the utilization, number of unique employees, what they're coming for. We kind of went the highlights. So what the financial summary is that you have on the screen, that's taking a look at the plan information relative to our cost, and then getting a cost differential, and then coming up with an ROI based on what our down at the bottom, what our program fee, what our management fees are to get an ROI. So we look at a couple components in that to get the ROI. One is that it's the professional office visit. So that's taking a look at your primary care, your specialty care, what your professional services are, costs on the plan, and we get a blended rate for that. We're not taking any ER or urgent care type costs for diversion. We know that happens, so we're using just the blended rate of the professional services cost. So we get that plan information, and then we look at what our costs are, and the way we do that is we add our staff, our supplies, and that's all staff, and then we come up with a cost for how many visits that we do, and that gives you that number there. Same thing for the labs, same thing for the prescriptions, and in some cases where we have advanced imaging, we'll have an advanced imaging cost there. We put the presenteeism costs in there because we know that's a real savings, but we don't use that in our ROI, but it is there just to kind of show you. So we would get what your employee hourly rate would, what an average rate would be, to kind of give you an idea of that, what an hour of time looks like away from work. So down at the bottom, you get to a marketplace savings that's adding up the cost differentials there between the different buckets. And then we put our program fee in there, get you an ROI. So that's how we calculate that. And that's done for each year. So for 2021, which would be the next page, the county, based on that calculation, it was a little over about $546,000 in net savings. That's with all health center expenses. So repeat that for 2022. That was $307,000. And what changes is if you had the time to look at it, what's changing in that is the driver in mainly the professional service cost. The county did institute a different program for their prescriptions. I believe they're using Optum. I'm pretty sure that's what it is. So they did change. So they did realize they've done some different unique things on that. So that if you notice when we look at the costs on the cities, that their prescription pricing on the plan is actually really good. It's actually one of the better ones we've seen with the management of it. So with that, if we move to 2023, it was $450,000 when you go through the different cost parameters each year for 2023. 2024, again, the big driver there was the cost in the professional services. There was a big jump there that revealed a pretty big net savings there. And then in 2025, it was just over $675,000 for 2025. And again, that's taking all the services, all our costs minus the program management fee to get that net savings is how we calculate that. So if you look at the last page there, which is a kind of a summation, 89% utilization, like I mentioned before, our target is typically 85. And when we say 85, what that allows for is last minute visits, next same day appointments, typically for an acute visit. When we hover in the high 90s is when we start to hear, I can't get an appointment, it's hard to get in. And what it usually comes down to is I can't get the appointment at the time I want. But yes, sir. Yes. Does that mean if the county employees, if 89% of the employees use your service instead of their standard provider? So what 89% means? So we have a budget at the county. So there's a set amount of hours available. What 89% means is of the available hours, 89% of the available hours are being used by the employees and the members at the county. What that means. The number just below that, when I reviewed, this is just an average of the 5 years, is 66% of the employees, but when I came here and we had the analysis of where we currently are, 71% of the current employees have utilized the center 3 or more times in the past year. So we have, what that means is the employees are use the word sticky, meaning they return to the health center, right? So that's the provider utilization really is based on like the budget that we've, based on the size of the city and the capacity. The current projection is based on 32 hours. So if we were running a higher provider utilization, say high 90s, we're going to have a conversation about if it runs for a long period of time, say for 12 months, and we start to hear I can't get in, appointments, it's taken me 2 or 3 days to get in, we then have a conversation about, do we expand hours or not? And then we put that, is it 4 hours, 8 hours, or whatever it may be. The next two items are just over 29,000 prescriptions. This is the copay savings based on what the county has. So this is what the employees have saved. Just over 293,000 just in copays for prescriptions, and 287,000 in medical visits. Now we're using their primary care visit when we know folks are sometimes if they from a specialist perspective they're coming. So we're just being conservative there and just using the primary care visit. Same thing with urgent care diversion. Urgent care is obviously more expensive, so when we have those appointments, I say that 85% is, we like to stay in that range because that allows for those sick visits to get in rather than going to an urgent care or to ER, which we know is more expensive. So when you add up all the 5 years, it's just $2.7 million in savings. So when we talk about that, like when we talk to the county and we talk about, or any of our clients, we look at that, it's like how taking our services and then taking all those services, all those visits, and then dumping them into the plan. That's kind of how you think about it. That's what the cost would kind of be. Any questions?
I just had a question regarding, so we have this, the prescription savings for members as well as the visit savings in terms of copays. That was included though in the net savings on the previous slides, correct?
No.
No, I thought I saw that as
No, it's not. No, the employee savings is not added.
So they're not part of that too?
No, neither is the presenteeism.
Okay, thank you.
Yes, sir.
Anything else from the council? Yes, sir.
Thank you, Mr. Mayor. Ms. Fuller, as we look at the presentation today and we look at kind of what we previously discussed between, the PPO being grandfathered in and the HMO, how does the cost savings, stack up between this option and what we had consensus on to move forward with? The savings is what I'm looking at. Is this more cost effective than doing away with the PPO, or is doing away with the PPO more cost effective?
They're both, it's together. They're both together is going to be the most cost saving. Okay. Right now, our claims are averaging, and the expenses came in for $790,000 for April. So some of those are claims and some of those are scripts. So that's broken down. So I think you're going to see an offset by having people go to the My Health On Site instead of going to their physician to get, eyes, ear, nose, and throat checked because I have a sore throat.
The premise of this is that it's going to reduce the claims because we're offering the services at a more manageable cost locally.
Right. It's a set cost, right?
Yeah, 100%.
Thank you.
And I'm not sure if I explained when I was here last time. So our model is, think of it as direct primary care. There's no claims filing to the plan. So what Lisa was saying is as soon as you start diverting the claims away from the plan, you start saving, right? Although there's a cost to operate the health center, you're shifting the buckets to a lower cost option.
I have a question with regards to Teladoc, because we do have Teladoc in our health right now, in our insurance options. So have you all, and forgive my ignorance on this, but if somebody does a Teladoc call, it's the equivalent of going to their doctor, correct? So it's still, it equates to a claim that way. Have you all seen a drop-off in utilization of the health center with the institution of Teladoc?
No, a lot of our clients have Teladoc, WebMD. There's several. I forget the one that Florida Blue uses, but no. Okay. We actually have, because our patients are sticky at the health centers. We actually have where you can have a remote visit via telephonic or televideo, the app.
So you all offer that too?
We do.
Oh, okay.
We do. But it's typically under the core hours of operation of the health center. We do have one client that's wanting to entertain having a physician or a nurse practitioner for after hours, say from 5 to 9. But that hasn't come to fruition yet. But all of our clients have access, all the employees have access to, online, telephonic or televideo capabilities to see our providers.
Based on the survey results that we received from the staff, I mean, it seems like this is something that the staff would use and is desiring for us to implement. I don't recall, forgive me, the estimates on the startup costs that we had. So I see that it looks like in a 5-year period, this is showing a net savings of a little under $2.8 million. So ROI, if we were to invest, I want to say it was around $800,000. Was that correct?
Yes.
Okay. Yeah, so we'd be obviously looking at getting that back in 2 years. It seems like if we're basing it off of these numbers. So is that about what you all came up with?
Yes. That was in our last presentation. I
Right.
believe. Yeah.
Okay.
But that's not including standing up another clinic.
Say that again?
That's not including standing up another clinic, which would have to happen.
That's correct. That's minus any facility-related
Have we
costs.
Have we
build
got
out.
any estimates what it would be if they stood up another clinic? Did we
You mean
get
if
those
we set
numbers?
up another clinic? Because our whole commitment was to partner with the county in the future.
Yeah.
So we would start a north side location, right? And then down the road, we would partner with with Flagler County to utilize their south location in Bunnell.
So what this basically is in addition to our current plans, which we're trying to save on now because we changed it up. Hopefully,
Yeah.
we'll save some money on that. But then coming back, this is just another cost to the city. So just walk me through this, Brian. Okay. A couple weekends ago, I busted my finger. I had to get 4 stitches. Okay. I'm on TRICARE standard, meaning I don't need a referral to go to a doctor. I go to my doctor. I pay my copay. So I go to the emergency room. Great. Kudos to Advent because I was in and out in less than an hour for 4 stitches. But when I was doing the paperwork and stuff, my copay was $129 for that visit. So, and now I have to wait to get my statement from TRICARE saying how much the total cost was, and hopefully my copay will be my portion of it, and I'll be done. So if I go to, in that scenario, if I go to your clinic with a cut like that, and I have the city's insurance,
Yep.
when I go in, I don't have to pay a copay.
That's correct.
But I won't be making a claim for my regular plan, which in turn is supposed to save both the patient and the city money.
Right.
Is that the scenario?
Yes. So let's walk that through. So you cut your finger, you need to come in, see a wee suture, whatever it may be, butterflies, stitches, whatever it may be. Now, if it's on work, that's a different conversation. But if you did that, cut your hand, whatever, you come in, there's no cost for you as the employee for the visit. There's zero cost. Zero cost for many medications that we may dispense at that time. And let's say let's check and make sure you can run labs too, if we had to run
I'm
labs.
sorry, I had to get a tetanus shot too.
So which we keep those in the center, so we could administer that as well. So none of that cost would be any copay situation for the employee. What gets billed to the city is the cost of the tetanus shot, right? And the cost of the staff. So we don't file, or like I said before, we don't file claims to insurance. And what that means is the fee-for-service world is what that is, right? For every you left the doctor's office and they have all the check marks on your bill. When you check out, those are billable items that they're billing to your plan. So none of that happens in our world. We pay for the doctor's time, we pay for the staff time, We pay for any supplies that are utilized, or DME, that's the meds that are dispensed, and labs drawn. That's it. That's how we avoid the fee-for-service world and keep the cost down. So from an employee's perspective, there's no out-of-pocket cost. So if we had to bring them back, let's say, let's come back. Why don't you come back in 2 days and let's look at it? No cost to you.
Again, so can you go back to the, this doesn't have the investment ratio return that the other slides did, but I think all the yearly ones have it. So the premise though is that, the costs for the services and the supplies and those things that you would bill directly to the city are going to be, so for instance, down here, the return on investment, right, 2.07 to 1. The costs, if we had done this through the plan, would be double, right?
Pretty much.
Because of the savings that you're enumerating on this list.
Yes. So the projections that,
It's in the slide deck.
okay. The spreadsheet that I have here, and it's probably hard to see. Yeah, there you go.
There it was.
Sorry about the small print.
Yeah, there's some bad,
Oh, here.
yeah, formatting in there.
No.
No, it's okay. We can see it.
Basically what I did, we worked with the Brown & Brown folks. They gave us plan data. So that first year is using your most recent plan data. And I believe when we talked, it was 12 months through March. Don't quote me on that, but I believe it was through March's claims. So that was the most recent claims that we had. So same process was done for that, as you saw in what we just reviewed for the county. Same process, okay? I looked at the same data. So that, I'm gonna put my glasses on. 489, if the utilization, it was at 85%, and we had, what that projection says is that the way we do that is we say that we're gonna do so many labs, which is, I did use a very conservative number. And what I did is I looked at like-size clients based on where they are today and just scaled it way back. And that's how I did the labs. And I was shocked that the lab pricing was actually pretty high. In our lab, we actually had a hospital want our lab contract because it's so good. Same process. We looked at the labs and we looked at the RX, and then kind of threw that into a projection, first year projection. To get the 5-year, what I did, couple of trends that I added. So the cost for the staff, I used a 5% COLA. We're not there, but that's conservative. We're typically between 3 and 4, but I used 5. And then for the growth, I used a 3% trend growth at the center, meaning first year we're going to meet 85, 88, second year 91. So that's how I trended that forward in terms of utilization, to then project out how many labs we're going to do, how many meds we're going to dispense. That ratio is based on the number of visits that you have. So that's how we got to that.
So here's another quick question. So say the contract for the first year is $850,000. Am I correct in saying that? Is that the right?
That would
amount?
be based on the 32 hours. Yes, sir.
32 hours. And say we have 600 employees. What if the numbers aren't there? Say only 30% of the city's employees go to that clinic.
Right.
Are we still going to be billed that $850,000, or is it reduced? Is it based on visits and what work you did?
So we're going to have a budget, and then we're going to staff it for 32 hours. So that would be the cost, unless the city says, you know what, we need to cut back. I mean, it's going to be 24 hours or whatever the number may be, and we would scale it back. That would be the option that we would have.
And this are just projections without one clinic not the additional clinic, all these projections.
This is based on if the city were to do this by themselves. So the gain that you have in the positive, and I actually have a council meeting in Southwest Florida next Tuesday, same thing. We have a city that we've been talking to for the better part of 10 years, and they are doing the same thing. The county said, put a facility, conveniently, it's in the north end of the county. Put a facility in on the north end of the county, and you can use our 2 facilities in the county, one in the middle, one in the south. So that city is it's on the consent agenda for them to push that through, and they're going to build out a facility that they already have ready to work on. Same thing, but here the county has 50. I want to say it's 54 hours of provider time a week. So if the arrangement comes to fruition and the county agrees to say, hey, we're going to use, right? So there could be conversations. So well, maybe we shift 8 more hours on the north end and have it 40 hours, and we have 48 or what is that? The 46 hours in Bunnell. So we can move that around. That works best to where the folks are. But if the city, given its size, would not have, it wouldn't be feasible from a financial perspective to have over 80 hours of provider time access to it. Does that make sense?
That would be
Right.
$1.5 million.
It'd be $1 million,
for us.
right? It'd be over $1 million, and just in provider time, right? That would be expensive to do. So this is also based on an MD budget. So we also, if we looked at, we can mix and match, right? Because we have access to an MD in Bunnell. We could split time. Our model is physician-based. Nothing wrong with having just a nurse practitioner model, and we augment with nurse practitioners all the time, and we do that. So we would take that and be able to mitigate some costs because it's instead of $125 or $130 an hour. And again, these are projections. So if we hired a physician at 118 or 120, that's the pass-through. That's what it would be. This is just the budget number. So we hired a nurse at 34. That's what it would be. This isn't what we're going to pass through. Right, it's just kind of give you an idea of where we're hiring at today. So we can augment with NPs, PAs as an example. That would bring that service cost down from a provider standpoint.
Any further questions from the council? Yes, sir, go ahead.
So I'm going to ask the mayor's question that he asked again earlier. This is straight operational costs. It does not include the capital costs of setting up a new site, correct?
That's correct, and we looked at leases, and they were ranging anywhere between $50,000 and $75,000 a year.
Okay.
And we would have to provide the building,
That would be leasing a facility.
so that's added on costs
Yes, sir.
to the contract.
Yeah, so I'm looking at the presentation that we were given. The initial projected investment at the beginning was between $380,000 and $388,000. So even with that first year investment and year one at a net savings of 49, we're still coming in the green, even with that initial net investment. And then I'm looking at the properties. They had 2 leasing options. One looked to be about $59,000 for rent, and the other was $67,000. That's what I'm looking from the
Okay,
staff
thank you.
Anything else?
I got another question, just to help understand it, because really for me this is about the numbers, and so when we're talking about the operations projections, right? We've got 150,000 for year one, and then we have this cost avoidance, right, of 489, 688. So that means the assumption, based on the assumptions of this model, that if we were not to use this, it would cost us $1.3 million for that first year because we're offsetting 1.3 and the net is now 489 in the positive, correct? Is that what I'm understanding correctly? That if we don't do this, the claims result will be like $1.3 million, and then we are paying $850 for the same services, so that we're gaining about $500,000 here by paying into this. Okay, I just wanted to make sure that my understanding of those numbers were correct. So, to the point, I think, even with those additional stand-up costs and operational costs in year one, it basically makes its money back, and then will pay us going forward. And I think it, provides a better healthcare option too for employees that would be limited potentially in who they could go to, only specific doctors, things like that.
I think for me, I'm looking at the future, right, of kind of the landscape that we find ourselves in, looking at what we have going on at the state level with property taxes. I think we're going to have to start finding ways to consolidate services, if I'm being really honest with the county. And I think this is a small way to do that and get some pretty significant cost savings for the city year after year. Additionally, in the last 4 years sitting in this seat, the claims just get higher and higher and higher. And it is super depressing every time we have a budget cycle roll around and we have to look at the increased cost of insurance. It's astronomical what we pay. So to the extent we can gain some control of that back in this way and save money and also start kind of that consolidation a little bit of services with the county, I think this is just a really smart way. And it's something we're going to have to start thinking about on a larger scale as far as how we can get these cost savings by working with our counterparts at the county.
Yes, sir.
I'm probably the last person to be talking much about this because I have full, military retirement health care, and I don't use the healthcare system. But I was on the county for 8 years. And just on talking to people, it's not a scientific survey, I never had anyone who worked for the county complain that they didn't like having the annex right there to use. So just about 100%, I would say, in the 8 years, when I talked to people about it, they were happy to have the facility there, and they did use it. Now, it is true the sheriff pulled out of that system, and there was a whole bunch of reasons to do that, not dealing with different things. First year cost savings, things like that. So I wouldn't, as far as the employees at the county, not the sheriff's office, I always had good comments from the people I talked to about it.
Thank you.
Did the sheriff give you a specific reason why he pulled out?
To me, no. Every year, from a plan perspective, the sheriff would look at the cost on the plan, not health center, right? So I don't know what precipitated the separation, but I will say that it was challenging for employees that were coming to the center and then weren't able to come to the center. So I think there was an option provided to the sheriff's employees, but I don't know what exactly that was, but it was different.
I'm not sure either. There were costs involved, first year savings, going to a new plan, things like that.
Yeah.
There were a lot of things that happened with that.
Yeah, from a plan perspective.
I just basing it on the staff, the non-police.
In health insurance, you hit the nail on the head. Post-COVID, pre-COVID, the claims were 9, 8, 9, 10%. Post-COVID is just gone ridiculous. Plus the with the specialty meds and those types of things have just really driven costs out of hand. But when you talk about the plan and the savings, if you're fully insured, meaning you send your premium to Blue Cross or Florida Blue or United or Cigna or whoever it may be, you send them the whatever number it may be, and you're done, and the claims are whatever the claims are, and then at the end of the year, or they come to you and give you a renewal, and you haggle over the renewal. But when you're self-funded, you're responsible for claims up to a certain specific, which is called stop loss, specific stop loss level, you're responsible for all those claims that fall underneath that level. So when you have a health center in place, your first dollar, which is called first dollar claims, is immediate because you're not paying those claims anymore to your TPA, right? You're paying a fixed cost to us to basically shift those claims away from that. So you have 4 buckets that, when you're self-funded, you have 4 buckets that your claims fall in: professional services, prescriptions, inpatient, and outpatient services. When you look at that number and you add up those buckets to 100%, typically 32 to 45, sometimes it's 50% when you look at school districts, professional service and RX, which we immediately attack that, $1. So that's where we get that shift, and that's where those savings come from.
Ms. Fuller, real quick, how much, if you have these numbers, how much does the city pay in health care costs per year? Do we have a basic sum of that?
Well, like I said just a
This
few
may be
minutes
shocking to
ago,
everyone.
our expenses for April came in at $790,000 for 1 month.
That's crazy.
So if you
That's
multiply
large.
Multiply that by
12.
Don't want to pass blame, but people ruin the healthcare system in America. Anything else from the council?
I was just going to add that, in terms of just strictly ROI, if these numbers hold true, then it's a good investment. Essentially, it looks like we're making upwards of $500,000 per year, going forward. The only thing that I think, to kind of touch on, I think what the mayor was getting at before with usage is that this only works if we promote and drive usage to it from our employees. So I would expect a healthy campaign constantly to remind employees that this is the option for them that is both cost effective for them as well as the city. Because I think, obviously if you can go somewhere for a cheaper cost, you don't have to pay the copay, you will. You just need to know about it and know that it's available and know how easily you can use it. So that would be my expectation going forward if we decide to go with this.
Yeah, I would just say, it's the old idea of change. People would have to change the way they go about their medical care and where they go, and that's always is a problem. So it almost would like you need to do maybe a couple of years to really test it out to see if it's working, and that's a big deal if you do that.
Especially if you take on leasing a facility.
Yeah, yep.
So to touch on that as well, how often will we, as council and future councils, will we be able to review this every year and approve the
Yes.
contract of going forward to make sure that these numbers that were projected are in line with what we're actually seeing in cost savings? Because, obviously there will be a transition, right? That it's not going to be 100% utilization, on day one. Word of mouth is going to happen. People will get emails and things, from staff telling them about this and, the opportunities they can use this. So I expect that the staff utilization of the facility will slowly grow over time. But I want to make sure too that this is being reviewed and make sure that these cost savings that are projected are what we're actually seeing, because otherwise, the premise that it's a good ROI goes away and we should move on to something different.
Right.
Yeah.
But
Yeah,
yes,
I
you would see
also,
it
I think
annually.
practically speaking too, there's so many, what I hear from a lot of people is that there's a lack of primary care that's available. So this fills that gap. I know so many people that just go to a walk-in because they don't have primary care. So
There's either long wait times or they're not accepting new patients at all.
Right.
Right.
Yeah, so this would help that, I think, in a big way. And then, you hope that if people are able to go to that primary care because it's there, the potential of catching something at the beginning rather than because we hear that a lot too. If you don't catch something sooner because you're not going to primary care, it becomes a larger claim later on. So I just think that, looking at it even bigger picture, it's a good move as well, because I think it will provide for a healthier staff longer term as well.
Another hit the nail on the head again. Totally agree with you from a primary care perspective. It is a dire need for the country as a whole. I think we've been blessed, and we've kind of fell in that void to help that. But yeah, it's definitely an issue. And to your point about prevention, and I'll go back and talk about the how we go about and kind of show everybody about the health center services and what we do from an orientation perspective. But one thing that we'll do at the beginning, we'll run a big campaign to do what we call a vital health profile, or VHP for short. So basically that's a lab assessment and a follow-up physical. So we're going to go through health history, we're going to draw labs, and I can't tell you how many times we have discovered that folks have something going on that they had no idea is going on. And it's mostly us guys that haven't been to the doctor in a while. And we uncover it all the time. Why did they come? Trying it out. Maybe their first visit was a sick visit, and then we get them in, we get the labs done, and we help eliminate that barrier. Maybe it's cost, or it's too far for them to go, or they can't get into their primary care. So there's a lot of reasons why, but we've never had a health center fail because of utilization
So,
or lack thereof.
an interesting thing is that my company's healthcare, I think for similar reasons of, potentially people just aren't utilizing their healthcare. I'm healthy. I don't need to go to the doctor every year or whatever. They offer sometimes a one-time incentive for the annual physical, right? That incentivizes people to show up, get their physical, then you can find some underlying minor problems that may become bigger problems, and the claims would be increased for that. So that's potentially something to explore as well.
We have clients that do that from an incentive perspective, but I think you'll be pleasantly surprised of folks that use the center that come without having to have a fixed. Totally can do it, but you probably don't need to do that. Just the inherent that it's close. You have potentially you'd have two options potentially, and being able to have an appointment the same day. To your point, primary care. If you called your primary care right now to try to get in, that's not happening. You're going to a Centracare or a CVS Minute Clinic or something like that to get seen. You're not seeing your primary care on the same day. It's just not, unless you have some sort of concierge medicine where you pay a fee to go to them. But it's just that's not the real world. Being able to get in that fast.
Anything else from the council? We're not making that decision today, Brian. I'm going to open this up for public comment. We don't have to open it up for public.
Just a presentation. You guys are just giving direction today, so no official action is being taken.
Okay, so right now, I guess look at the estimates, Ms. Fuller, on how much for the standing it up, the other clinic. We need those numbers before we get into the budget cycle.
Yes, sir, we'll get that gathered up. And
Anything else from the council?
Do you all need any other direction from us at this time?
no, I don't think so. I think this is a start.
Awesome. Great. Thank you so
I
much.
think, Brian, I appreciate you coming back because there was some confusion, and I think you cleared up a bunch of it.
Happy to be here, and if there's any questions that if you think about afterwards, certainly just get with the team, and I'd be happy to. I'm here all the time, so have no problem coming back to address any questions or concerns that you have, and we'll work through that.
All right, thank you, sir.
I just wanted to say thank you, and thank you to staff.
Thank you.
Thank you, Ms. Fuller. Okay, we're moving on to public participation. We're going to allot 30 minutes for our first public participation. Please refrain from any items that are on the agenda. So if there's anyone with public comments, please come forward.
Is this public comment to that, or is it public
This is,
participation?
there's no you can comment on that if you like, but this is just open public comment.
Okay. My name's Jeannie Duarte. I'll save that for later. First, I'd like to know who approved the data center, the landing station under the square footage, with the intentions to expand. When was it approved, and at what meeting? When was the public viewing? When was first read and second read? And expand to what? Future eminent domain? I have been researching the history of the compensation of the Palm Coast. And the facts raise important questions about transparency and voter awareness. Originally, in 1999, compensation was by ordinance, with only temporary allowance up to $1,200 for the council and $1,800 for the mayor. By 2018, our governing document itself, the salary was $9,600 and for council member, and the mayor was $11,400. In 2018, the ballot language did not mention the removal of compensation language, yet by 2019, the fixed compensation language disappeared, and in 2022, by ordinance, the council compensation raised to $2,495. The mayor compensation was over $30,000, while also adding automatic cost of living, plus health insurance or cash equivalents. I'd like to know what amount is that cash equivalence. Today, qualifications, the records, result in more than $3,000 in candidate qualifying fees, which I paid. This is not an argument against fair compensation. It is an argument for transparency, accountability, and the effects this will have on future elections to come. The people deserve a complete documented explanation of when these compensation provisions were added, when they were removed, and how those changes, complied with the charter amendment process required by Florida law, statute 166.031. Thank you.
Thank you, ma'am. Anyone else for public comment? Yes, sir. Mr. Mayo, correct?
Yes, sir.
Yes, sir.
Good evening, George Mayo, Palm Coast. I'm here to talk about the development that is going on, the outdoor mall at the southwest corner of 100 and Belterre Boulevard. We talked about this before. Part of the consent agenda, item number 2 at the last business meeting, was us having to pay $400,000 for a piece of property because you need 12 extra feet for a turn lane. This is the exact same thing that happened over at Starbucks and the Aldi Center. When it was going in, they were supposed to have a exit lane and a dedicated right turn lane onto 100. It wasn't going in. I questioned the council. I questioned the city manager. Why isn't it happening? The answer was, oh, the developer wants to put the buildings in and he'll do that after. Well, he never did it after, and it became upon the city to pay for and put in this dedicated right turn lane. Now, when they, planning or zoning or whoever agreed to this development, when they looked at the blueprints, if they looked at this and said, gee, that's fine, did they just rubber stamp it? Did they drive the 1.5 miles down and park in Starbucks parking lot and just look at it and see that this is going to be a detriment to traffic pattern? You're going to have one lane only turning left at the far south exit there for any traffic that wants to go north, east, or west. One lane onto a 2-lane road. Why was there no entrance and exit on 100 like there is at Aldi's? How did this go through? And now it's incumbent upon the city to have to pay for this extra money. This is a mirror image of what went on across the street, exact same thing, and we're going through it all over again. We're going to have to pay city money for something. I am not against development, but I am for smart development. This is not smart development. Why was this not in the original plans to figure the traffic pattern out? People who live on Zebulus Trail, when they want to pull out, as I've mentioned before, traffic backs up. There's times I've waited 4 or 5 traffic lights to get out onto 100. Now you're going to be dumping all traffic who wants to go that way out of one lane. Zebulus Trail, people sit there, and when traffic backed up, nobody will let them in. People will block the southbound lanes, block traffic. Is it smart? No. Is it dangerous? Yes. Can I understand it? Yeah, because nobody will let them out. So people coming out of this development now are going to do the same thing. And I know they're going to block traffic. And the very first entrance and exit, which how many times people pull into Starbucks in a hurry to get their Starbucks, turn illegally into the do not enter exit there. I personally have called the city several times and said, hey, the do not enter sign has been knocked down, you have to replace it. I don't know if you could put a stop work order on this, relook at this, or the council needs to talk to the city manager to give better direction to the planning zone, because this is this is a quality of life issue for anybody who lives south of 100. Traffic is bad, and it's only going to get worse, and the developer is going through this cheap and not doing it the right way. Sorry. Thank you.
Thank you, George. Anyone else for public comment? Yes, sir.
Hey, Dewey Schoenfelder. I play and coach lacrosse here on Palm Coast, and I'm requesting that the lacrosse goals at Indian Trails get unchained and potentially 2 move to Wadsworth Park. There's like 20 goals there, and they're all chained up, and me or no other people in the community can go and play lacrosse. Yeah, so I'm just requesting that they get unchained.
That's it?
Yeah.
All right, thank you, sir. Mr. Hurst, hold up your hand so this gentleman can speak to you.
Yeah, I spoke with him. I went to the Parks and Rec meeting last week, and they told me to come here and express my concern to you guys.
Yeah, go right ahead real quick.
A little out of order, but can you explain a little bit more why it is you don't want them at Indian Trails and want them moved to Wadsworth?
No, so I want, like, ideally, like, a couple at Indian Trails and a couple at Wadsworth Park, but they're all chained up at Indian Trails.
They're currently not being utilized.
They can't be used. They're all chained up.
Okay. I gotcha. Okay. All right. Thank you.
Yeah, we'll follow up with staff.
We'll look into it.
Make sure they get your contact info so we can follow up.
Yeah, all right.
Thank you, sir. Anyone else for public comment? Yes, ma'am. Miss Amaral. Mrs. Amaral, your husband's with you.
Carla Amaral, Palm Coast. Good evening, Mayor and Council. I would like to speak about what I believe was a missed opportunity from the May 19th approval of the Palm Coast Park Amendment. First, I want to be clear. I am not criticizing the applicant. Developers should make a profit. My concern is that the city did not fully evaluate the value being created by the amendment and whether there was an opportunity to secure public benefits at the same time. The amendment approved 244 single-family homes with smaller lots and reduced development standards. Those changes have economic value. Smaller lots allow more efficient use of land. 1-car garages cost less to build than 2-car garages. Smaller homes cost less to construct than larger homes. Using conservative estimates, these changes may create at least $40,000 in additional value per home. Across 244 homes, that represents approximately $9.8 million in value created through a city-approved amendment. Again, there is nothing wrong with a developer benefiting from an amendment. The question is whether the public should also benefit when additional value is created through city action. Could a portion of that value have been used to create workforce housing opportunities? Could there have been contributions towards parks, trails, transportation improvements, or other community priorities? For example, if just 10% of the estimated value created by this amendment had been dedicated toward workforce housing, that could have represented nearly $1 million for down payment assistance, impact fee assistance, or workforce housing trust fund to help local families achieve home ownership. That is our teachers, nurses, firefighters, and seniors on fixed incomes. My request tonight is simple. Going forward, I ask the council to require every amendment application to include an estimate of the financial value being created by the requested changes. If an amendment increases density, reduces lot sizes, lowers development standards, changes land uses, or otherwise creates additional value, council and the public should know approximately how much value is being created before a vote is taken. That information would not dictate the outcome of an application. It would simply provide transparency and allow meaningful discussions about whether there are opportunities for workforce housing or other public benefits alongside private development. Thank you.
Thank you, ma'am. Anyone else for public comment?
Good evening, Tony Amaral, Palm Coast. I want to make sure before I start, the part before was a presentation. Is that considered on the agenda? I have a question, that's all.
You can make a comment to it.
So the only thing I saw with that is all the numbers were based on county. County has about 350 employees, 350, and they were already being utilized 89% of the time at 32 hours. These numbers need to be changed because we have about 600 to 650, and 32 hours will not be able to be used by all of them just by mathematics alone. So if 350 people are using 89% of 32 hours, how many do we need for 600 plus? I'm thinking that should at least be maybe changed to 60 hours, a combination of actual doctor and maybe a nurse practitioner, but that might be something, and I could be out of way, but that's the way I understood it. So just something to think about. Thank you.
Thank you, sir. Anyone else for public comment? Yes, sir. Mr. Davis.
Good evening, Mayor and Council. Tonight, I would like to discuss accountability. Not accountability after the damage is done, but accountability before it happens. Palm Coast Engineering Design and Utilities Code, Section 9.04.05C, states that stormwater systems shall be designed to collect and convey stormwater flows through the system without creating adverse impacts to adjacent properties. Those are not my words. Those are the city's words. So my question is simple. What policies are in place when an adjacent property is adversely impacted? Who investigates the complaint? Who determines whether the technical manual standards were followed? Who determines whether an exception was granted? Who reviews and approves that determination? Where is that documentation maintained? And how can the public verify it? These are not accusations. They are straightforward questions about process, transparency, and accountability. If there are no formal policies requiring written findings, independent review, and documented decision-making, then residents are left relying primarily on trust. Government should provide more than trust alone. Government should provide transparency, documentation, and verification. I respectfully ask this council to direct staff to develop and publicly present policies that include written findings whenever a development approval results in a complaint that adjacent properties have been adversely impacted by stormwater. A documented review of applicable technical manual standards, including any justification for deviations or exceptions. Preservation of review comments, approval records, and audit history. Public disclosure of approved deviations from established standards. Periodic audits to ensure standards are being applied consistently and fairly. I also respectfully ask that these recommendations be brought back before the council for public discussion and consideration. A standard that cannot be verified is not truly a standard at all. A policy without documentation is difficult to evaluate. And when there is no clear public record explaining why a standard was or was not applied, public confidence suffers. Before I close, I want to make something clear. This is an election year, and I am not here campaigning for anyone. I am here for the residents of Palm Coast. Regardless of who wins an election, the standards, accountability, and transparency should remain the same. People come and go, administrations change, council members change, but residents are the ones who continue living with the consequences of the decisions made today. The city already has the standards on the books. What residents are looking for now is action, because actions speak louder than words. The public deserves more than promises. The public deserves proof. The public deserves confidence that the rules mean the same thing for every resident, every builder, every engineer, and every city employee. I am simply asking that we create the policies necessary to ensure those standards are verifiable, documented, and constantly applied. Thank you.
Thank you, sir. Anyone else? Yes, sir.
James Durso. I might be behind on some of this. I apologize. I've been busy. But what about the water restrictions? I know we're under restrictions right now, but you're proposing 22,000 homes out west. Florida is already overdeveloped. It's a known fact. And then now you're talking about a data center. They're saying, oh, it uses recirculated water. Well, that's not true. They have to use fresh water, and it's going to be a problem, aside from the noise in the neighborhoods. But several months ago, it was maybe earlier this year, maybe last year sometime, we had St. John's Water Management in here saying, analyzing all our needs and stuff like that, and we're pretty much at capacity. So what's going to happen? Are we going to end up with like $400 and $500 water bills because we're short, something like that? So what's the real story on our water for at least our town anyway? What's going to happen in the future? Now, besides that, we have a big noise issue. And if you noticed it, but a lot of cars, a lot of motorcycles making extremely loud noise and backfiring. I live in the southwest corner of Belterre and Pine Lakes in the wonderful Winfield. I can tell you which street the cars are on, which way they're going. There's so much noise with those things. The sheriff says, well, they catch them, they fine them, and then they go back and do it again. They keep refining them. So either they're not, fines aren't high enough, or else these guys have a lot of money to burn. So we need to get a little bit tougher on catching these people with this noise. It's ridiculous. This afternoon, it was 2 blocks away, and a motorcycle came around from the 3 blocks, two houses, a street behind me, around, all the way around, and I can hear him all the way down till he got down 3 blocks away. That's how loud it was. So we really need to do something with that. But to be positive, your e-bike laws, I think they're quite effective. I know the sheriff's cracking down on them. People are saying, oh, they're just trying to get money and harass people. No, it's about safety and responsibility with the e-bikes, and I'm glad you came up with that. I hope they do more to educate these kids and make them realize, how much of a danger it is with them not really, playing the laws. If you walk across the street, you're a pedestrian, you have a right to crossing the street, but you don't walk blindly. You stop and look. The same thing with these kids on bikes. If they're crossing, they should stop and look for other traffic to make sure that they're seen. So I commend you on that, and I hope you can resolve all these other issues. Thanks.
Thank you, sir. Anyone else for public comment? Seeing no one come forward, we'll bring it back to the dais. You got any follow-ups, City Manager?
Those citizens that we do need to follow up, sir, we will, of course, follow.
Thank you. Council?
I was just going to mention, there was a mention about the healthcare or cash equivalent, and on that topic specifically, we do not receive a cash equivalent of anything if we don't utilize the city healthcare system. You can actually, I think, look at the line items for the city budget that are on the portal, and I think updated every week, and it'll show the utilization of that specific line item is fairly low. Based on what I see, it looks like one person exercises the healthcare system and the rest do not, and therefore we're way under budget in terms of that, and we don't receive a cash equivalent. In terms of how the salaries got to where they were, that was before I think everybody here was on the board, and so there was multiple public meetings about the ordinances that were passed. So That's where it is now. I think the intent there was that prior to that, the salary was pretty low for what they tell us is a part-time job, but seems to be more than that sometimes. And I think the intent was to try to attract more people of working age and not just people that had the time, that were retired, things like that, that were well off, that could afford to kind of come up here and not get compensated. But none of us voted on that, and none of us put any of that through. Noise issue, I agree. I mean, I hear it all the time as well. I'm not sure what we can do except for, speak with our colleagues at the sheriff's office and ask them to do some focused enforcement. It's definitely a difficult thing, just like e-bike enforcement, that sometimes trying to pull over a car because their muffler is loud, it happens very quickly and they're gone before you can do that. So enforcement is tough in those situations, but I absolutely agree that, sometimes it's disconcerting sitting in your backyard trying to enjoy, your backyard and having to hear cars fly by very loud. And then, Mr. Mayo, in terms of that intersection, I agree that intersection has some issues. I know a lot of what the assumption is that we can just say, hey, developer, you've got to do this, right? Or you can't build here. The reality of state law is that there's concurrency, that's a requirement. There's a calculation that determines how much impact they'll have on an intersection. And then that's what we can ask for, essentially. And then a lot of times when they do that, it comes in the form of impact fee credit. So one way or the other, it's coming to us and paid through by us, or it's paid through by them and they're getting credits for that, unless, of course, there's essentially an amendment to a previous agreement, at which point then we kind of have the latitude to say, maybe we need something extra as a public benefit in order for this to happen, for this change to happen. But for already entitled properties, there's a lot of state law that defines exactly what we can request out of a developer in terms of their impact on that infrastructure in the area. It really just comes down to a formula, and that's what it is. Now, we could get into the argument of design and whether it's good design or bad design, and that's a different thing, I think. And I'm not a traffic engineer, so I wouldn't be able to make those arguments. I'd have to rely on the expertise of others. So I think that addresses most of what I was trying to get out.
Go ahead, Councilman.
Thank you, Mr. Mayor. I drive by there all the time, and I ask myself the question, why don't we have an entrance from the State Road 100 side? I mean, I'm not a traffic engineer either, but to me, it defies common sense. And I would like to look at that because it's already a problem on Belterre heading south, and we're just talking an entrance and an exit point to alleviate some of that traffic that's already existing there on Belterre. I don't know why there's not an entrance there. I'm sure there's an answer, and I'd like to know that answer. Why isn't there an entrance from the State Road 100 side?
Which one are you talking about? You talking about this end or down south?
Down south. So like if you're coming from Bunnell, right, and you're going east before you get to Belterre, why can't you enter from the State Road 100 side? Right now, there's no entrance. And I think that's what Mr. Mayo is asking about right there. And so I think it's a great question that we should probably have answered, and where that decision-making process was made along the way. I think right now it defies common sense when we already have an existing problem.
And correct me if we never saw it. This was administrative, right, based on state law. I don't think we ever saw this development, or maybe it came before this council was seated.
Yeah, I don't remember it being up here, so no.
I don't ever recall having a
Carl,
conversation about
Carl,
it.
could you follow up on that and provide us some information as far as down on the south end, what the plans are, and how to fix that? That's it.
And then to Ms. Amaril's comment, I mean, I think we can certainly consider that. I think jamming an applicant at the, on second read is not the best practice. I think it's, we're always looking for workforce housing, but certainly, it's the standards and the expectation should be laid out front. So how we would do that, I'm not sure, but I think it's something we should consider.
That's it? Councilman Sullivan, anything? Nope. Councilman Miller was correct on that. None of us receive any type of in lieu of, because most of us don't take the health care. So we don't get any extra pay for that. We did not set the pay. I ran because I was opposed to it, and I can't try to roll something back with people that were not responsible for it. The people that are sitting on the dais came into the job at that expected compensation that was on the books. If it were up to me, I'd do it, but I can't. The data center, all that was approved while I was running, and I ran from February 2003 up to the election in 2004. But the one thing I do remember was the rezoning to allow for the fencing and stuff around it. And I kind of knew something was coming, but it's not a data center. It's a cable landing station. I keep saying that over and over again. That's just a jump off point into the states from across the sea. But it was between February 2023 through August of 2024 was when you can go back and check the records and you can see when all that came before the council. For Mrs. Amaral, the same thing. Kind of hard to push someone to do something like that at the last minute like that. And there was no density increase on that project. It was not a density increase. But Carl, if you could follow up on that South End question for Mr. Mayor, I'd appreciate it. Anything else from the council? Okay, we're going to move on. We got minutes to approve. Item F, minutes of the City Council meeting, May 19th, 2026. Business meeting. Anyone have any amendments or corrections to the minutes?
Mr. Mayor, move approval of the minutes.
Got a motion to approve? Got a second? All in favor, say aye.
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 All opposed? You good, Ms. Cook? Okay, we're moving on to the consent agenda, and we could pull some things from this, but I think with discussion we can get through it unless someone wants to pull something from the consent agenda. But we do. I have at least a couple of things I'd like to talk about. Everybody good with that? Yeah. Okay. For me, as far as the interlocal agreement with and I've been hearing it in the news, Chief, but my biggest concern is full cost recovery. And that question was answered yesterday by the city manager and the attorney that we will be full cost recovery. The only other part about that, are we going to be required for some of our firefighters to cover down overtime to fill in those slots of the people that are vacating to go to Flagler Beach? And if so, are we being compensated for it?
As Chief's working his way up here, Mr. Mayor, I do believe we have worked those figures into this package as well.
Yes, sir. So we modeled the reimbursement on a FEMA reimbursement schedule that we had just done for our deployment. So Chief Clark has briefed me on this. Him and the team back in the fire department have got us going on this. Kyle Berryhill, interim deputy city manager, and other stuff too. But yes, we do believe this is full cost recovery, and but this is 100% being funded with overtime. It's part of why it's a little more expensive than maybe seems off the layman's look. Yes,
so
sir.
Our men and women that are going to work for Flagler are doing it on overtime?
Yes, sir. So we've already put it out, in anticipation, as if we'll begin Thursday if you choose to approve this tonight. And the folks have already volunteered to pick up the first 3 shifts. So there'll be about a month of our team being their C shift.
Okay, thank you. My other question was, and you can stay there too, Chief, for this one here, was on the fire service fee thing as one of our strategic priorities. I don't have it in front of me. I can't see that number. I don't know if I mentioned it last time when we talked about the SAP. I am not in favor of doing any additional fees unless the state pushes us to do that through property tax referendum. I am not in favor of adding any new service fees for our residents. So that is not something that I'm in favor of. I'll approve the consent agenda, but that's one thing that I'm not comfortable with at all. That's the only 2 items I had. Yes, sir. Councilman Gambaro first.
Thank you, Mr. Mayor. Chief, I just wanted to touch on the interlocal agreement with the city of Flagler Beach. So I just want to make a comment. I know that often when there's an emergency, we respond, as a good teammate and battle buddy, with other municipalities, like 55%, there's a lot of times that we jump in, and we've gone out as far as Palatka, right? So I see this as being a great teammate moving forward. Just kind of looking long-term, because we don't know how long it's going to take for Flagler Beach to staff up. And we did speak about it yesterday, City Attorney, but I wanted to make sure that everybody knew that if there's an additional ask, it will come back to this council for approval to make sure that we understand what the requirements are and what the long-term commitment would be, especially if our firefighters are working off of overtime. So I just wanted to make those two comments. I think this is being a good teammate and good battle buddy, and it's doing the right thing because we're all in this community together. But just want to ensure that from an accountability and a transparency perspective, we have this built in so that it will come back to council for further review if this support has to continue.
Noted, sir.
Thank you very much.
Councilman Sullivan?
Right. I just wanted to mention on the 27-28 strategic action plan, the 10 items that we prioritized, and they're in the way we agreed to at the last working group. But my point on them is this. There's no point in having these 10 priorities if we don't conform to them. We're saying in 27-28, those are our 10 highest priorities. If something comes before me that's not associated with any of those 10 comments, I would have a hard time approving it. So I think one of the things we might want to do in the coming year is when decisions come before us, as far as spending money or new developments or all that kind of stuff, we have a way of relating it to these 10 priorities without all of a sudden, well, that sounds pretty good, so we'll do that. So anything that comes before us and we don't have within those 10 priorities right now is number 11. Or higher. So it would be nice maybe to, when the decision is before us, we say that's in conformance with strategic priority 3, just so we have a way of relating it back. Or there's no point in doing the priorities.
Yes, sir. Anything else, the rest of council?
No, I was just going to add, in terms of the interlocal, echo Councilman Gambaro that it's being a good neighbor, right? There's always a time in the future that we're going to need help, and so this is our chance to help and still get compensated fairly and appropriately, but our chance to help when someone else is in a time of need. So, one day we'll need some help. So I'm all for that. And then just wanted to also highlight the irrigation pump and that that's budgeted and planned, and we've had this brought before us multiple times in the conversations about the golf course. So I'm glad to see that, but also just want to reiterate that, going forward, we want to see all costs associated with the golf course encapsulated within that budget. So it's got a clear picture of where we're at in terms of the golf course. That's all I got.
Just the one thing I had, I know, again, kind of similar to your position, Mayor, excuse me, on priority 3, for Track 17, it says to accelerate the path forward on entitlements and right of first offer on Track 17, and then work with senior staff on an RFP. I just want to clarify my position on that based on what they were wanting to charge for entitlements. I would not be in favor of trying to purchase those entitlements. So to the extent we are trying to figure out what to do with Track 17, and that helps to guide, I don't know where the rest of council is on that. I know we were looking to obviously, try to get a private company in here to pay for those things. I would not be in favor of that. Again, I'll approve the consent agenda, but I think we talked about prioritizing Track 17. I don't know that we truly fleshed out, making it a priority to actually purchase entitlements for Track 17. Particularly based on the cost. So I just wanted to clarify that for the public's benefit.
Yeah, I think right now we're still at prioritize figuring out how to utilize this as an economic development tool or some other thing for the city, but we don't really know what that looks like right now.
The way it's going with those people that own the entitlements, we're going to turn it into a dirt bike track. Four-wheel and dirt bike.
Make a motion.
So you're good? You're good other than that, Vice
Thank you,
Mayor?
Mayor. Yeah.
Okay.
Mr. Mayor, move approval of the consent agenda.
Got a motion to approve?
Second.
We got a second. We'll open the consent agenda up for public comment. Anyone have any public comment concerning the consent agenda?
Tony Emerald, Palm Coast. My concern is the consent agenda number 3. On page 72 and 73 of your packets, at least that's what it is on mine, First of all, this contract is from 2025. And on section 2, it actually talks about a fuel price redetermination. When the price of fuel increases by a minimum of 10%, the awarder respondent may petition the director. This was over a year ago. Fuel's gone up close to 50%. Asphalt is a petroleum-based product. It has gone up. None of these figures actually have what it will cost you today to piggyback onto this contract. So maybe we do go out for bid, and maybe we finally get a bid where they can piggyback with us. I know this council has talked about doing road repairs and repaving and trying to figure out how to pay for it. So that might be incentive to get Halifax Paving. I mean, they're a well-known company. They've been around for a long time. It's not a question of them. But I just didn't see any information that actually says, what are we paying and how much? Because I did see that 10%. And with fuel being the way it is, I would be curious on what that is. I guess we're like 16 months later with those fuel increases. So it would be something to look into, and again, maybe go out and then maybe renegotiate, and maybe Ormond can now piggyback on ours. Thank you.
Thank you, sir. Anyone else for any discussion of consent agenda? Who would have an answer on that, Carl?
My understanding, though, is this is just one of multiple vendors that we can use. So this isn't locking us into a specific vendor for one project. It's a as-needed basis.
And it says a minimum of 10%.
That is correct. This is just an additional tool in our toolbox. We would use it more on small-scale projects where we need a little bit of work done. We typically can't get bidders to do that type of work, so this would be, we obviously would get the price, and if it's off the chart, we'd just go out to bid specific for that project, so.
Thank you, sir. Does that answer your question, Mr. Amaro? North-south? Button? Talk to Carl. Any other public comments? We'll bring it back to the dais. Any follow-ups from council? Ms. Cook, call the vote.
Vice Mayor Pontieri?
Yes.
Councilmember Sullivan?
Yes.
Councilmember Gambaro?
Yes.
Councilmember Miller?
Yes.
Mayor Norris?
Yes.
Motion passes unanimously.
Thank you, ma'am. We're moving on to item H, ordinance of the second read. Mr. Duffy's going out there to take his position. Ordinance 2026 XX Amendment to the City Charter.
Good evening, Mark Stuffy, City Attorney. I do not have a presentation for you. This is the second read of the ordinance where we're amending the charter. Be 3 amendments. There were no changes last time as directed by City Council, so I'm here for any questions or comments.
Thank you, sir. Anyone find anything in there that they were not happy with? Can we? Yes. Can we get a motion to approve?
Motion to approve.
Second.
Got a second? We'll open it up for public comment if there's no other comments from the council. Yes, ma'am, Ms. Duarte.
Jeannie Duarte, the first read was a disaster. The city manager and city attorney are our only city charter officers, the gatekeepers to the Palm Coast City Charter. The charter belongs to the electors, the voters, not any of the council, not committees, not consultants, not special interest groups. Florida Statute 166.031 provides only 2 ways to amend the charter: by ordinance proposed by the council or by petition proposed by the electors. In either case, the amendments must ultimately be approved by the voters. 2011, Palm Coast change election years from odd years to even years. The city acknowledged the changing election dates and extending terms require a charter amendment and voter approval. 2013, former supervisor of election Kimberly Weeks raised concerns that the amendments appeared on the primary ballot rather than the general election ballot, as required by state law, and she requested a formal attorney general opinion. According to published reports, the city declined. 2019, the charter was replaced in its entirety. 2022, April 19th, The mayor and council gave themselves an excess of 151% raise with a yearly CPI increase with staff, investments, and health insurance, or the cost equivalents, cash equivalent, if they didn't already have, if they had insurance already. A few days later, in 2022, on April 25th, additional changes were made to the charter without any ballot amendments. Palm Coast public election history only goes back to 2010. The online Municode charter archives only go back to 2012. Why? If a charter provision change, show the ordinance, show the ballot language, show the election results, show the voters approved it. The charter belongs to the people, and the people deserve a complete charter history from 1999 to today. Thank you.
Thank you, ma'am. Anyone else? Seeing no one come forward, we'll bring it back to the dais. Any follow-ups from City Council? Ms. Cook, call the vote.
Councilmember Sullivan,
Yes.
Councilmember Gambaro,
Yes.
Councilmember Miller,
Yes.
Vice Mayor Pontieri,
Yes.
Mayor Norris.
Yes.
Motion passes unanimously.
Thank you, ma'am. We're going to recess the City Council. We're reconvening the State Road 100 Corridor CRA Board. The only item we have on this for the board is number 1, State Road 100 Community Redevelopment Agency Resolution 2026-XX, approving a contract with Kimberly Horn for the comprehensive performance and strategic evaluation of the State Road 100 Community Development District. Mr. Gregg is here. Ms. Helena, can you come join him? Because I may have a couple of questions for you, if you don't mind. Yes, sir, Mr. McKinney.
Good evening, Council and CRA Board. On March 8th, the CRA Board requested that staff re-examine the scope of services associated with the proposed comprehensive performance and strategic evaluation of the State Road 100 Community Redevelopment Area. Staff supports moving forward with this effort because the CRA has not undergone a comprehensive evaluation in many years. While there was an update completed in 2018 in-house, much of the analysis relied on data and assumptions carried forward from the original 2004 report. As a result, we lack current, independent analysis regarding the CRA's performance, market conditions, and future revenue potential. In addition to the need to update the underlying analysis, staff believes it is important to evaluate the CRA's performance against its original expectations. As discussed during the previous presentation, taxable value growth within the CRA has fallen approximately $839 million, or 74% below the projections contained in the original redevelopment plan through 2025. Understanding the factors behind this variance is critical to establishing realistic expectations and strategies for the remaining life of the CRA. With approximately 8 years remaining before the CRA sunsets in 2034, it is important that we understand how to maximize the effectiveness of the remaining life of this district. We need to identify strategies that can optimize redevelopment efforts, quantify realistic future revenues, and provide a clear understanding of what projects and investments can be supported moving forward. As staff works to maximize redevelopment opportunities before the CRA sunsets in 2034, we are already seeing positive results from our business development efforts. For example, staff is currently preparing an agreement for the sale of approximately 8.5 acres along State Road 100 for a proposed 36-bed, for-profit medical rehabilitation hospital. The project is anticipated to generate approximately $31 million in capital investment and create roughly 100 full-time jobs with an average annual salary of $75,000. Projects such as this highlight the importance of understanding how to best leverage the CRA's remaining resources and opportunities.
Just for clarity, that's physical therapy, correct?
Yes, so, yeah, exactly, right.
I just want to make sure nobody jumps to the wrong conclusion there.
Right, right. No, so after a patient has a serious injury and they receive the acute treatment at the hospital and it's time for rehab, this would be the location. Which quite frankly, I'm going off script here, but it brings a lot of value to the community. I think all of us have heard from citizens, right, that are having to travel to Jacksonville or Orlando or for physical rehab. Importantly, though, the study is not being undertaken solely for staff. It's intended to provide this CRA board and future CRA boards with the information necessary to make informed policy and investment decisions during the remaining years of the CRA. Following the board's direction, staff conducted 2 stakeholder meeting workshops on April 2nd and worked closely with Kimley Horn to refine the scope of services. Through that process, several items were removed from the original proposal, including analysis related to the potential CRA expansion or contraction and a finding of necessity evaluation for the Old Kings Road South area. The original proposal totaled $139,988 and included a $15,000 contingency. By removing these items, the proposal was reduced by approximately $43,000, resulting in a revised contract amount of $96,770. To put that investment into perspective, current projections estimate that the CRA will generate approximately $24 million in revenues between now and its expiration in 2034. This study represents roughly 0.4% of those projected revenues. Staff believes that the revised scope represents a focused approach that retains the core financial, market, and strategic analysis needed by the CRA board while eliminating work that wasn't necessary at this time. This is likely the last major strategic evaluation conducted before the CRA sunsets. The decisions made over the next 8 years will determine how effectively the remaining $24 million in projected revenues are invested, making this analysis a relatively small but important investment in informed decision-making. Ultimately, this evaluation is about ensuring that the city and the CRA board have reliable data, independent analysis, and a clear strategy to guide decisions over the remaining life of the CRA. Staff believes that this investment will provide valuable information to maximize the impact of future CRA expenditures and position the district for success. Thank you, and I'm happy to answer any questions.
Reading the script. Anything from the council before I get on this one here? Anyone?
Just really quickly, I just wanted to thank staff for going back and getting the contract price down. I know that was one of the things that we asked based on, I think, what was probably more of like a boilerplate type of plan that we maybe didn't need and was a little larger in scope. So thank you for doing that.
Yes, ma'am.
Thank you, Craig. Helena, you sent me that information. We have one outstanding bond in the CRA, right?
Yes, Helena Alves, Finance Director. That is correct. We have one loan still outstanding. The balance September 30th was $2,409,809, and we have 3 years of payments left.
Okay. And how much does the CRA trust fund, what's the balance in the trust fund right now?
So,
and do we have any other outstanding debt?
So the purpose of the CRA is that you budget to have a zero fund balance every year, right? So you're investing those funds into the community. So it isn't necessarily designed to carry a balance forward. Now there are other outstanding payments related to the Kickstart program beyond the bond.
And how much is that? 1.34 maybe?
I think it's a little bit. Give me 1 second. I didn't have that one.
I'm sorry, I should have asked for that information too.
I believe we have 2.7 left. Let me make sure.
And we owe that because of, and everybody's going to enjoy this one. What is that Kickstart program? What is it again? And we owe that money to those people.
So the Kickstart program was approved a few years back, I want to say 17, 18, right around that time. And it was an incentive for the development here within the town center. So there,
And is it- Go ahead, I'm sorry.
a SEAC credits that are due back for the developed properties. There was a program of, I think, depending on the square footage, there was a calculation applied, and you were entitled to a credit for it, and the funding source is the CRA.
This, you said CIAC credits? Is that?
Yes, that is correct.
So impact fee credits, yeah.
And this was the, if I'm not, correct me if I'm wrong, was this the $5,000 per apartment
Yes.
that was going in?
Yep.
So we credit him impact $5,000 per apartment. How many apartments?
E-
Who knows the number of apartments?
So,
Does anyone on the staff know how many apartments we subsidized?
so we have the Palms, Central Landings, the Gables, Haven, and Retreat on the list.
So we have been subsidizing apartments in the town center through the CRA funds, correct?
There is a calculation of credit, and they get applied at some point when they come in for the development.
See, this is my line of thinking. I don't think, me personally, I don't think the CRA should have been ever created because there was never any real blight here in this district. And this is, all this money, for those that don't know, the CRA funds, everything above the correct me if I'm wrong, Helena, everything above the 2004 rate, property tax rate, all that money cycles back in, not just from the city, but from the county into the CRA.
Yes.
Okay. So we have had 22 years of this with, and how many, somebody do the math real quick. How many square miles is 1,100 acres? Somebody with a phone, do a calculation real quick for me. So we've had this money on average $2.5–3 million a year coming into the CRA.
Right now, it's just reached the $3 million.
$3 million for 22 years.
I want to say 25.
That's older than my son, my youngest son. We have been paying, all that money instead of going to the general fund has been going into the CRA. And, you know, through the years, there's no telling what else happened to the money. But I can tell you that we took out loans. We took out a bond, right?
There was two loans
Two bonds.
originally. One has been paid off, and this one is from 2014.
And it has 3 years to be paid off.
That is correct.
Okay.
26, 27, and 28.
So, Mr. McKinney, you guys are trying to figure out the strategy and figure out why it hadn't been successful. And it's been failing to achieve like $128 million that was expected to come into the city coffers, correct? We're short, like $128 million.
For that current total, I know that we're short right now as far as what I have in front of me. $839 million or 74% below the projections that the original redevelopment had us up to this point.
So the CRA has been a dog for 22 years. That dog won't hunt. For me, what I'd like the council to do, I would like to see about sunsetting the CRA now. That money, that $3 million a year could be going to our general fund to help with roads and other projects instead of coming into, how many square miles is the CRA? Anybody figured it out?
Well, just for clarity though,
Yeah.
the county taxes that go into it wouldn't come to us, so,
We bid our half of it.
well, it's more like 2/3 of the county and 1/3 is ours, so we would get 1/3 of that $3 million back to us.
I think it's 55-45.
Is it a percentage base? I thought it was based
It
on
is-
their millage rates.
It is pretty much 1/3, yes. The county's projection for this year was 2.157, and the city 1.148. So about a third of the
So
$3
we
million.
we're one city, but we've isolated down 1,100 acres to get special treatment other than the city. That money could be going to the general fund instead of to the CRA. Because it's basically done nothing. It's like the CRA has accomplished what it needed to accomplish. We got rid of those small blighted areas, and now we have on the west end we have the Southern Recreation Center, we have the Promenade, we have the theater, we have the miniature golf going in, and quite possibly the YMCA down on the south end. So that's what I'm trying to get at. I think we should sunset it now, because I got a sneaky feeling that somebody's going to want to extend the CRA and extend lands in it, and I'm not in favor of that. And we know. I don't need Kimberly Horn, and I know they do a great job, but I don't need someone to analyze and tell me why the CRA hasn't been successful. It's because they haven't built. This has been like a little fiefdom in the city for 22 years. That's just my perspective.
Mr. Mayor? Yeah, so I have a couple of questions. When was the CRA first established?
2004.
2004.
Okay, so those of us that have been here since 2006 know what happened in 2008, right? Everything stopped, right? If we look at all the charts on, tax revenue coming in, it was upside down. Most people in the city were upside down. And so that's the first thing. So I think that could be, that could be, a reason as to why, it got a false start. But, again, way before us, way before we were on the council, that $8 million sale that Craig, Mr. McKinney just talked about, could we use that to pay off that debt?
So any proceeds that would come into the CRA could be used to satisfy the debt.
Okay,
Yes.
so potentially, if that sale goes through, we could settle that debt and we could be down to zero. It's $8 million, right? We said we owe 2.7.
7, I believe, on the Kickstart, and 2.409 on the
little over
loans.
$3 million total outlay.
Okay, so, but the purpose of the CRA is to facilitate economic development. And the CRA is more than just town center, right? We got parts on Old Kings, right, and other places. It's more than just the town center. And so my perspective is if we have this tool to help us drive economic development in our community, why stop it now? If we can get it to zero, which I agree with the mayor, that, I don't know the decisions that led to that, but if we can get it to zero based on a sale, and that's not the only property we have for sale, right? What other properties do we have for sale? Is that the only one within the CRA?
Well, we also have the 7.79 acres that extends along Bulldog behind Wawa.
Behind Wawa, yeah.
And Councilman, if I can just make one clarification, the number for the it's 8.5 acres that's for sale. The actual sale price is going to be approximately 1.7.
Oh, okay.
Yes, sir.
Thank you. But again, we
Yes,
could, those proceeds can go to pay that off.
Yes,
Okay.
we could.
I think we've got a tool here to help us advance economic development. And it's incumbent upon this CRA board to drive it. How can we use this economic development tool in a positive way versus not letting it, watching it go into the other direction. And we've got a lot of positive traction. We've got the promenade, we've got other areas, we've got this sale. You got potentially other areas closer to State Road 100 north of 95 that could be utilized to bring in economic development for our community, real economic development, not just retail. And so, Mr. Mayor, I respectfully disagree. I think we should sustain the tool to see how we could continue to drive forward, go ahead and pay off any debt that we have, and we as a team here work on seeing how we can leverage this tool all the way up until it sunsets to drive economic development. Thank you.
The CRA, Councilman Sullivan did the math, it's 1.79 square miles. And it runs from Belterre, the western boundary is Belterre, northern boundary is Royal Palm, eastern boundary is Old Kings Road, southern boundary is State Road 100, correct? Yes. And the vertical incentive program, we've even pushed that further north. That's north of Central Avenue, right, John? It's north of Central Avenue. And that's completely unrelated to the CRA. It just happens to be in the CRA. I just don't think that this is a tool. I don't want to invest any more money in it because the developers in this area have not done. Have we had any takers on the vertical incentive program, John? Just the north and south or east-west? No takers on that. You can't get any more incentive than that, right? Up to 80%. And that's at post-construction, right? So That's my feeling is, and we also would have to get the approval from county, and I'm almost certain county would say, okay, sunset it, we'll take our cut. Because things are gonna change, and the majority of property in town center or in the CRA is commercial. What percentage? Do we know the percentage of what's commercial and what's residential?
I don't have that in front of me, Mr. Mayor, but I'm glad to track that down for you.
We had all the entitlements in that. There was another presentation about a month ago, I think, when we first saw this. I think that talked about remaining entitlements for the CRA area.
My point is, we've blocked off this little piece of the city. And all that money that has flown in or flowed into the CRA over the years, those potholes out over there north of the eastern roundabout up near Royal Palm, there's potholes that's been there for 5 years. So what has been done with the money other than incentivize more developers to build more apartments and us pay the impact fees for water, which makes no sense to me. I don't even know why they approved that. So, yes, sir.
One small point, not on the bigger picture here, but I don't like paying, would there be an interest gain in paying the debt, that 2-year debt off early? In other words, if there's no gain in like interest costs, if we're still going to pay all the interest, the dollars are worth less a year or two from now. So I don't see any big deal in paying that off.
The interest 2029 is $168,000, correct, Helena?
Yes, so there was a loan modification that reduced the interest rate to 3.45%. I'm not sure if it's subject to any prepayment penalties, this specific loan or not. That would have to be something that we would look at.
Yeah, if there's an interest gain, yes. But if we're going to pay all the interest anyway, I don't see paying it off early.
Could we get us a payoff quote on that, Helena? Could you ask them?
Yes,
Okay.
I could request one.
See, because we are struggling with money in our general fund. And I think I asked a question yesterday or the day before, Helena, about we borrowed from the reserves to do roads, right? Did we put $1 million, $1.5 million from
There was a
reserves?
transfer of 1 million, not necessarily a loan to the streets fund. It
Not
was
a
a
loan,
transfer.
I'm saying a reserve from the
That
reserves.
is correct. Yes.
So of that $2.5 million that we did for roads last year or this fiscal year, half of that came from the reserves because we don't have enough money. So, that's just my opinion. I really don't see it why we'd have to pay another $100,000 to tell us what we already know. Really.
So my take on it is that this is a good tool for economic development, regardless of whatever happened in the past. And I think we've had a big focus on this for the time that we've been here, Mr. Mayor, about trying to get economic development going in the town center. And we're seeing that from the commercial side that we haven't seen in the previous 20 years. We're now finally seeing that. We're seeing the promenade, we're seeing the YMCA, we're seeing that the mini golf and different things that people want to come here to do. And so it's finally starting to generate increased revenue that it hasn't really done in many, many years. I would hate to get rid of a tool that can have a positive impact, especially when you consider that a chunk of that money does not come from our taxes, would not go into the general fund if we were to get rid of the CRA. And if we get rid of the CRA and that 1 million flows back into the general fund, are we going to dedicate it to $1 million in paving in town center? Are we going to use it for something else? So my fear is that it then becomes just washed out into the general budget and then doesn't go to some of the priority things that we want to do in town center for economic development that I think really do have a chance here in the next few years to create this momentum to where it's not $3 million, it's $5 million or $7 million, and then we can do more things. And then when that CRA does sunset, those are contributing to the general fund in a way that greatly outpaces the cost of maintaining this area in terms of roads and things like that. The bottom line is we'd just be giving away $2 million a year and growing if we sunset the CRA.
But it helps the county, and it's not just the CRA. We invested this last budget cycle. We gave $1.3 million to help the promenade from general fund. That didn't come from CRA funds. That came from our general fund. So, and that may have been a mistake on our part, and maybe I didn't catch it, but that money should have been coming from the CRA, not from the city's general fund.
No, we made that a priority on the strategic action plan as an economic development incentive, and I think we all voted yes on that.
Yeah, but I'm saying, but the funding was from our general fund. It wasn't from the CRA. It should have been from the CRA, not our general fund. That would have been another 1.3 million that we could have used for roads or other repairs or other projects. But like I said, we roped off this 1.79 square miles, and all the money above the 2004 on property taxes comes back into the CRA. And it's like zero balance, and we owe money out of it because of decisions of past councils.
So I'll give you my 2 cents on it. I see it from both sides, honestly, Mayor. I agree with you in part because I think that this CRA was manipulated in the past. And I believe that that manipulation came in the form of incentives for residential, for apartments, impact fee credits, whatever it may be, however we want to call it. It's definitely not something that this council has supported, nor do I think our current staff has supported it either. Right, it would never pass this council, absolutely right. Matter of fact, I think we even removed the incentives specifically for residential that we have currently, right? So you can't get incentives for residential in the CRA right now with what this council passed. So we nixed that. We can't fix kind of the sins of the past. We know that for a lot of things. My concern at this point, because I agree with you, I don't think we should extend the CRA. I think that it needs to start being self-fulfilling and self-feeding, you know, and those businesses and those lands. You know, you can only help something along for so long, and I think that once it does sunset, we will have done our job in trying to make that come to fruition. My concern with kind of throwing a wrench in things right now is that we have seen momentum over the past year or two. I don't want to stop that economic development momentum. We have all made it a priority up on this council to invest in economic development. And investment is just that, an investment. We have to invest if we're going to see a return on that investment, which we are seeing through the promenade, which we are seeing through the miniature golf coming, which we are seeing through the rehab center the physical therapy rehab center that Mr. McKinney explained. And we possibly have some other things coming, and I don't know what kind of NDAs we're under, so I won't say anything, but I know that there are other things in the pipeline that will be positive from an economic development standpoint. So for that reason, I don't want to kind of change things at this point. My question for city attorney would be, do we have the ability to ensure, whether it's through resolution, ordinance, probably not ordinance, but maybe resolution, that the CRA will sunset, in fact, and that it cannot be extended, or maybe add another step for council to have to extend the CRA once that sunset date arises?
Yeah, I can research it, but my initial response would be.
I know county has to approve it, and I doubt county would approve it.
But it would have to be just like any other ordinance that or resolution, you take a majority, but if someone wants to overturn that, they can overturn it.
Well, and I agree with that, but again, it would take 2 votes, right? Because then you'd have to overturn an ordinance and then, or a resolution, and then you'd have to then vote to extend. So you're just adding one more step. But we know that when that happens, that gives more of an opportunity for the public to give its input, the county to give its input. Yeah. So it does make it tougher.
Well, I think they have to vote, right? Wouldn't the county have to vote to approve the CRA extension?
Yeah, it'd be mutual parties.
If I'm correct through state statute, we can sunset it now. The county would have to agree, or we could say we want out of it. If you want to continue it, we pay off our portion of the debt. The county continues it. I could be wrong. Research would have to be done to figure that out.
Yeah, I'm just hesitant to give away money right now because it would go to the county when we need it for economic development.
Rather than the developers?
Well, it's not going to the developers right now. It's not. You say that, but it's not. The money right now that we are bringing into the CRA, and we've said this, it needs to go to improving Town Center Boulevard. It needs to go to getting commercial tenants into the promenade. That is not money that's going to developers. It's inappropriate to call it that. Now, I agree with you. In the past, when some of these apartment buildings came up, that did occur. but we have stopped that. So what, now we stop it and then just put a kibosh on the entire thing and give money that is coming into the CRA for economic development, we're just going to give that away? I can't get on board with that. I can get on board with ensuring that what the programs that we have now are being utilized in the right way, which I think we have fixed those wrongs, and then saying it should not be extended either geographically or time-wise. But I think we have a lot of really good momentum right now with our economic development. I just don't want to see that go by the wayside at this point.
Okay, one quick follow-up, John. If you can come up, please, John. As far as the economic incentives we're offering from the promenade, are we committed to anyone right now? Has anyone taken advantage of that?
We have a application from one company. You're going to be receiving a presentation from city staff that's going to indicate the number of LOIs and executed leases that we have for the promenade. What we're finding is that the commercial component is taking longer than expected because of the architectural and engineering required to build out kitchens and to build out these spaces. It's just taking longer than the promenade expected. So our grant timing is off. We will be asking you to carry over those funds. Unfortunately, we set a sunset date on that grant application of August 15th. That's not likely to happen. It's likely to carry over into next year. But they have many active prospects, and there's a lot of work underway to finalize those leases over there. And again, we'll give you a listing of those leases. I've asked for the promenade to provide that to us. In terms of use, maybe not company names, but definitely by use, so you have an idea of what's coming.
Okay, so we're only committed up until August with those, and it'll be up to us to carry over those balances into the next budget cycle.
Yes, sir. And I can tell you that it's becoming a problem because as they try to finalize these leases now, they know they can't get the improvements done before August 15th. That's a problem because we will not pay the money until the project is CO'd and we can verify the improvements. So that timing is off, sir.
So you will be asking us to carry over.
Yes, sir.
It'll just be a carry forward of funds already budgeted
That's right.
and earmarked for it.
Economic incentive funds, we'll be asking to carry those over.
Yeah.
I just want to make sure that this council, and maybe even the next council coming, that we are not taking general funds to support facilities and operations in the CRA at all. I don't see that happening after this date.
This is the Economic Improvement Fund we're using for this.
Yes.
Yeah, here's what I'll say too. I know for me, I get often from the public, well, why don't we have any nice restaurants? Why don't we have any cool things to do at night? Well, the reason is exactly what, John, you just explained. It is so, even a grease trap, I've said this, I've used this example before because anybody who has opened a restaurant or built a restaurant knows that a grease trap alone is stupid expensive. And the things you have to go through, approval-wise, build out, it's crazy. So it's really hard for, and a business is already, or I'm sorry, a restaurant's already a hard business to actually be successful and not fold. So these economic development incentives do help that. And I know for me, I'm constant, I've heard it from other council members who said, well, we can't control a private company choosing to come here or not. Well, this is a way that we can encourage that. So I think we need to continue to encourage that, stay the course right now, and let this come to fruition, knowing that we have these things on the horizon, that we've got a good team that's working on it. And then when it's time to put a stop to it, and to your point, Mayor, to make sure that we're not using other monies that can go towards infrastructure, but we're only using the monies that we've already committed to make this thing happen.
Fire suppression is expensive.
It is, yes.
I agree. I think, we can talk about it. It's a tool. Sometimes people use tools poorly. Sometimes they use them well. I think that we've addressed this in terms of how it was used in the past and what the intent is. This study is just going to further hone that intent. But in terms of overall using the tool, this is an opportunity for us to use it in the right way going forward to kind of finish kind of the promise of what was supposed to be around here 20 years ago that, rightfully so got stalled when kind of the country turned upside down in terms of the housing crisis and all that. But I think we're starting to get it back on track, and I'd like to see us continue the vertical incentives. That's very fresh. We haven't even got really a chance to get that out there and see results from it. So I'd prefer to just, give it a chance to move forward and continue the momentum.
Well, I'm willing to do that, but also the vertical development is tied to the CRA's sunset date, correct?
Yes, sir. And again, for a point of clarification, I believe that the ordinance that created the CRA calls for it to sunset in 2034. So the ordinance that created it also calls for it to sunset. And it would require county approval to extend that. And I believe state statute limits it to 30 years also. So it's going to sunset in 2034. And I got to tell you that on the 7.79 acre next to Wawa, we have a very aggressive plan to develop that project, and I will need the CRA to help with that project.
Yeah, it's not against you guys, Craig, John. It's just, it's been a mess. And I know you guys are doing your God's honest best to get us on track, and I really appreciate it. Don't take it personal. It's just government.
Thank you.
Anything else from the council? Can we get a motion to approve?
Mr. Mayor, move approval of the resolution.
Got a motion to approve?
Second.
We got a second. Any follow-ups from city council? We will open this up for public comment. Hello, Miss Darlene. I hadn't seen you in a while.
Darlene Shelley, K-Section, Palm Coast. I'm honestly shocked that you're thinking about extending this CRA after seeing all the numbers of how it's been bleeding, hemorrhaging money, not coming anywhere close to what it was supposed to have delivered. The citizens, the residents of Palm Coast, been speaking to hundreds of them, and they all say the same things. Why are we getting so many apartment complexes? Why can't we get something with quality jobs? Where are the quality restaurants? Like Councilmember Pontieri said, when you call the quality restaurants and you ask them, please come to Palm Coast, they don't like the direction the city is going. Respectfully, Councilmember Miller, we are not on the right track. We have gone off track for Palm Coast to be the beautiful coastal city that my friends and neighbors and family chose to live in. The quality restaurants don't want to come here because they see the city becoming nothing but high-rise apartments. And for the city residents to find out today that Palm Coast government subsidized apartment complexes, $5,000 each, to build this monstrosities all over our beautiful city, that the homeowners who spent their life savings for their forever home, for their $600,000 home, for their $300,000 home, for their $2 million home, that is not what we bought into. We were sold a bill of goods. And I want to know where the billions of dollars in interest from the CRA went to. Not in my pockets. Somebody got rich off of it, and they're continuing to get rich off of it. Where is our downtown center with music and restaurants? We don't have it. We were ripped off. We continue to get ripped off in our utility bills, in our water bills, for paying $320 million for utilities, and then we get in a data center. That's not a coincidence. We've had enough. We're fed up. We're not going to take it anymore. We demand better for our city that we love. Thank you.
Thank you, ma'am. Anyone else for public comment? Seeing no one come forward, we'll bring it back to the dais. Miss, any follow-ups from the council? Ms. Cook, call the vote, please.
Councilmember Gambaro,
Yes.
Councilmember Miller,
Yes.
Vice Mayor Pontieri,
Yes.
Councilmember Sullivan,
Yes.
Mayor Norris.
Yes.
The motion passes unanimously.
Thank you, ma'am. Okay, we're going to recess the city, we're going to adjourn the State Road 100 Corridor CRA Board and reconvene the City Council. City Council back in session. We're going to move on to item I, our last public comment section. Anyone for final public comments? Don't rewind and say the same thing, Ms. Darlene.
Yeah, you're probably right. I don't want to come up here and not have anything intelligent to say, but honestly, the residents of Palm Coast are hurting. Everything is more expensive. Gas is more expensive. You know, I try to bring up the extra gas tax, and I'm told that we don't have an extra gas tax when we know that's not true. Whether you can do something about it or the county has to do something about it. And it's the same old song and dance. That's not our jurisdiction. The city points to the county points to the FAA or the FDOT. The truth of the matter is, Palm Coast is falling apart. I drive through town center every day to visit my mother in my old HOA. Driving through town center breaks my heart because I know what it was supposed to be, what we were told it was going to be. Something beautiful, a place to ride your bike and get a cup of coffee, go to a bakery. You have to bribe businesses to go there. We don't have anybody lined up to open a business there where we subsidized that building to be built. More apartments that we don't need. Driving over to Flagler Beach on the left-hand side, more apartments, more density, more residential. Yet, the lots that could have given us diversity in our tax base for more doctor's offices, more quality places to shop, more quality restaurants. Not this board, previous boards and mayor changed the zoning, authorized special exception uses, bent over backwards for developers and builders and landowners to build whatever they wanted. In other cities and states, the city and the county demand infrastructure is provided by the developers. Oh, Mr. Developer, no, you're not going to get $5,000 per apartment. You're going to pay to pave the road. You're going to pay to put in the turning lanes. How hard is that? I know that you didn't make these mistakes yourselves, but you can fix them moving forward. And Palm Coast can return to the beautiful city that we chose to live. Thank you.
Thank you, ma'am. Anyone else for public comment? Final public comment? Yes, ma'am.
For a public hearing notice for a rezoning? I don't know. No.
That's not tonight, ma'am.
That's not tonight. Okay, because it had today's date on it. No?
No, ma'am.
Okay.
What does it say?
This is, yeah.
I'm sorry, what was that?
I'm sorry. If it is what I think it was originally scheduled to go through. I think the applicant pulled the application, so it's no
Didn't show
longer
up on
part
the
of this.
agenda.
Yeah.
Okay, so
They're required way out in advance to tell you guys, right? They'll send them to a certain, they have a certain radius of where this is happening that they've got to send out postcards. They put yellow signs or orange signs out, on the roadways near the area to tell you. So they're required to do that by law. And so I think when it went to planning board, there was a vote that occurred. And I think they made the decision that they didn't want to carry it forward, so they pulled it from the application, so it's no longer coming to us tonight, but it may have originally been scheduled for tonight.
Okay.
That's the one up in the L section, right?
I think so.
Okay.
It was on Otis Stone, Hunter Road?
They're talking about something else.
Oh, okay.
Yeah, because I got an email about that actually from a concerned resident. Can we maybe help her out, city manager, about when that would be coming?
Is that here?
June 2nd.
Would that be, I guess it is within the city, right?
What's
That's
the
part
name?
of the,
What's the name of the ordinance? What is it?
It has an application number, and it says the city council will hold a public hearing on 6 p.m. June 2nd here.
if I could just, if we could get, what's your name, ma'am? Excuse me?
Jerry?
Jerry, if you could please see Mr. Kyle Berryhill back there with his hand raised, we'll get you squared away.
Thank you.
All right, thank you, ma'am.
Anyone else for public comment? Yes, sir.
I know.
Good evening, Mayor, Vice Mayor, and council members. My name is Adrian Calderon. I live in the newly established Marbella Apartments off of White Mill. I'm a 26-year-old resident of Palm Coast, been here for almost 20 years. And I will start by saying I emailed you all back in March, give or take, about the city's policy on park usage. We are now entering the summer period, almost to the fall, where city lights are going to be needed for lighting up the parks. I am a regular soccer player in the community. I play with a bunch of people aging from, say, 15 to all the way up to sometimes 65, 70-year-old people. There's sometimes 60 to 70 of us at a single time playing on Wednesdays. During the winter and fall of 2025, when we tried to organize, say around 6 o'clock p.m., that's when the sun starts getting set down. We don't have access to city lights. We used to be able to go to Wadsworth Park, which I understand is a Flagler County maintained recreational area. However, for some reason, we've been doing it for 4 years where we can turn on the lights and it'll be set on the timer. This past cycle, it's been locked and we tried to get people out there and they said that we needed to pull a permit for lighting the fields. I asked, all right, how can I do that? And they said that you need to be either a soccer league or organization. I don't know why. I'm more than happy to pay whatever permit fees. I tried to do the same here. We try to go to, say, Indian Trails, or I believe that's the only park with lights. So we try to go to Indian Trails, and we were given the same answer. We need to pull a permit for lighting, as park leagues and park teams, soccer teams reserve the fields for lighting and practices. We tried to, or I inquired to see how I can pull a permit for said lighting, and I was given the same answer that I either need to be a soccer league or some type of organization in order to pull that a simple resident or a simple recreational soccer player, sports player, athlete can't just pull the permit. It needs to be tied to some sort of league. Personally, I don't think that is fair, as we organize about 40 to 60 of us at a given time, and ideally, it would be nice to play soccer a little bit earlier in the day, 3, 4 o'clock, but during the work week, when most of us get out 4:30, 5 o'clock, and say we give an hour to get ready and go organize, by that time, we only have 30 minutes of sunlight. That's when the lights need to be turning on and things like that. I would ask that maybe the city looks into the policy, or if I'm understanding the policy incorrectly, maybe get a little bit of a clarification on how normal residents not tied to any legal organization can possibly utilize the field lights, but I greatly appreciate it. Thank you.
Okay, thank you. Mr. Hurst, hold up your hand. And if nothing else, sir, if nothing else, go to Florida Sun Biz and do a fictitious name and establish your own league. All it is a name and like $25, $50 to register with the state. Mr. Hurst will help you out. Anyone else for public comment? Seeing no one come forward, we'll bring it back to dais. Any follow-ups from the city council?
I just think if they're going to do that, I think maybe the question is when you have a number of people playing is insurance, some kind of liability.
I'm sure Mr. Hurst will.
He'll go through that.
Yeah, the unfortunate thing is that, as we all know, that we're, have a dearth of sports fields, right? And so the policy currently is to prioritize youth sports leagues and things like that, so that we can try to get as many people that are organized and will come at specific times and utilize the field so that we can get maximum usage of the fields and make it as efficient as possible. That's why it's like that. In a perfect world, yes, we're not utilizing these lighted fields almost 100% of the time. It would be okay for other people to come, and I wish we could do that. We don't have the parks. We got some lights put into, or putting them into. I think we just did the contract last business meeting, but on Indian Trails, so the fields behind the school, there will be lit as well, so that'll add to the inventory. We did lights at the softball diamond fields during the summer. And so we're continually trying to add to the inventory so that we can have people playing on sports fields as much as possible and provide more. But just like everything, we have a limitation in resources, and, choosing between adding a field or 2 or 15 versus paving roads or something like that. There's always a trade-off that we have to make there. And I know it's a focus of this council. It's just, in terms of funding and time span, things take time as well to build. But I think we're going to continue to prioritize that because we know it's a priority and a need for the community.
Thank you, sir. Any other follow-ups from the council?
The only thing I'll say on that issue is, I don't know if we have like an open play night or, something like that. And so maybe that's something we kind of look into, particularly now that we are going to have some extra lighted fields at ITSC. Maybe, and I'll send a quick email to James and you city manager to see if that's something we can maybe implement now that we'll have some extra field space. Maybe we designate, a couple nights a week to open play so that residents who aren't part of the league, because we've heard this before with other folks that get together and play, they don't, you see the basketball courts, for instance, at Holland Park, people can go out there and play a pickup game whenever they want. Unfortunately, athletes that do soccer and other sports that require these larger fields don't really have that luxury because we have so many leagues vying for them. But I do think that we should maybe look into a mechanism for that.
I would support that policy.
I agree. With the city manager. And
We'll discuss it at executive team tomorrow.
Okay.
Thank you.
Anything else? Follow-ups? Okay.
Oh, I'm sorry, Mayor. May I just make one other comment? I apologize to Ms. Shelley's comment. I can appreciate the comment saying that, this council didn't make certain decisions, but I think it's really important that when we say things like Palm Coast is crumbling and it's becoming this awful place to live, we've worked really, really hard up here to change some bad policies of the past. We've taken a lot of arrows for raising impact fees. We've taken a lot of arrows for taking away some incentives for residential development and, doing things that we are hoping will help the economic development. And I don't want to say slow residential development, but make sure infrastructure is keeping up with it. And when we say infrastructure is keeping up with it, we mean things like investing into our water system, which was way overdue. So, rather than kind of looking in the past and saying, look at all these terrible things that everybody did before you, I think it's really important that we look forward as a city and as council to say, let's kind of harness what we've tried to implement in the last couple of years and make sure that the people who take these seats moving forward continue to move in this direction. Because I do feel the city has been moving in a direction that the residents want and desire more. And yes, we're still seeing development come out of the ground, which people see all the time because of things that were approved previously. We can't do anything about that. And it's a waste of time to talk about it. So we can only fix things moving forward, make sure we're prioritizing infrastructure, prioritizing our core government functions, and try to positively affect what we can do for the city at this point going forward.
Thank you, ma'am.
No, I'm done, sorry.
That's okay. Just takes off time of your items not on the agenda, which we're moving into now. City Council items not on the agenda.
Yeah, that's right.
Councilman Gambaro, we'll go to the left first.
Thank you, Mr. Mayor. I attended the county's affordable housing committee last week, and part of the discussion, which I wasn't tracking, is that the county commission has given consensus for further staff to develop an ordinance on how to manage ADUs, which is interesting. And I asked, hey, what's the reason behind it? And they said, we're going to try to get in front of the state to give us an opportunity to kind of set the table as best as they think, within the county before we're preempted by the state. And so it'll be interesting to see what they come up with. And I think it's something for us to monitor and see if it's a good strategy for us to approach. But other than that, that's it. Thank you.
Thank you, sir. Councilman Sullivan?
Nothing more.
Really?
I have some things, but I'm not going to bring them up.
Okay then. Councilman Miller.
Yes, Mr. Mayor, I got a couple things. The first thing is I can't recall when we did board appointments if there is a secondary for the school's ILA oversight committee. That's you? Okay, good. So I got a conflict, so I just wanted to make sure someone
I'll be
was
there.
to cover. So that's one. In terms of the Gators, not much to talk about. I think we lost
Oh.
every playoff game that we played this
quiet
weekend.
right now
so.
about the Gators.
Well, hey, listen, I brought it up, so I didn't avoid it.
Go Gators.
And I don't think there was a playoff round or game that occurred this past week that we didn't lose. So, so it wasn't a great day, but always good to be a Gator. So, the last thing I wanted to talk about was data centers, right? And we hear all this, fears from the residents about what's going on with the cable landing station. But I think there's a lot of validity to the fears in terms of water usage, power, with that industry as a whole. And so what I wanted to ask was consent from the council to direct staff to look at the land development code. And what I was thinking here was defining these more strictly within the land development code, right, as uses. And then my thoughts are that we would have thresholds for what we would call high impact and low impact, right? And so some of those thresholds can be square footage, power consumption, water usage, noise generation, those things. And anything for any reason falls above those on any one of those categories, they would be high usage. Anything below that would be low usage. And so the reason why I'm getting at it is that I would like to place the high usage, the ones we fear, right? The big, gigantic buildings that suck power and water, in a special exception category of the land development code for zoning, to where it would always have to come before council and be approved as a special exception if it is one of those large data centers that, we fear, as residents and as myself as well. And then that still leaves the opportunity for by use or by right use for those low impact ones defined within the zoning.
Can I jump in real quick?
Yeah, sure.
So this was brought up at our last Northeast Florida Regional Council, Nassau County and others. I mean, there's a lot of concern out there. We kind of talked about it at our last meeting. Some counties are choosing to put in a moratorium. I think it's a bad idea. Anytime you use moratorium, it kills economic development. And that, they want to slow everything down or study it, right? And that's kind of the term that the folks up in Nassau County were doing. But I like your approach in taking a proactive measure of trying to codify in the land development code.
Yeah, I think it's not necessary.
Versus admiring the problem for the next year or something like that. And so I support it.
And we can talk about what those thresholds look like and all that, but I'd like to move forward with something that basically says, if this is a good project like the cable landing station, that's not banned or blocked. If it's something that is scary, that uses water, power, makes noise, is too close to schools, too close to residential, there's a lot of different things we can do to put in there, the classifications. But if it's one of those, then it's not a by right use, right? Within our land development code, it would have to be a special exception use, which means we as a council would always have the right to say no, and they don't have an entitlement to that use.
Right. Well, I would just say that, yes, I'm trying to do something like this, but I don't think we should automatically exclude things like a company comes in with a really big business, but they're going to build their own electric plant and build their own utilities, and it have no impact on ours. At that point, would you just automatically say that we don't want them?
I understand that. There could be like,
I would.
a lot of people
Why
would say
wouldn't?
Yeah. There's a lot of other implications that come along with these other than the power and the water. So I get that's a big concern, the water and the power usage, but if you look into what these things do, we're also talking about mass data storage and surveillance. And I'm just from a conceptual standpoint, not comfortable with that. But
I mean, it's the world that we're coming into.
I don't agree with it.
Well, you may not agree to it, but you may not be the one that'll decide.
I agree. I hear you. I hear
You can build
you.
a time machine.
But, yeah, there you go.
You'd have to use AI to do it though, so.
Councilman Miller, I'm glad you brought this up tonight because I was actually going to ask for a consensus from council to give a letter of support to the county for what Commissioner Dance's initiative was, which was to do a 1 year, I know I'm going to say the big bad word, but that's because it's what he used. He proposed a 1 year moratorium while we as government research these things, because I do think that this is a rather new phenomenon that people are still learning about. You know, the implications of them, the power, the water, what the differences are, like you talked about. So I don't think that I also think too that we're all kind of learning at the same time, and we're learning at a super fast pace, because truly, if you think about the onslaught of AI, it's happened very quickly. I mean, it's all of a sudden been very fast forwarded, and we're all kind of consuming all this information about AI, and data centers comes
A year ago, it was producing pictures with 7 fingers, and now it like you
Right.
can't tell the difference between a real picture. So
and voices. I mean, it's wild, right? So I was going to ask council just for a letter of support to the county in them making their decision just for a year while we research this, because I do think that we're going to see it's happening all over the country. They're popping up. So we really need to look
So-
at what happens in these other locations when these things, because it could be one of two things. It could be a lot of fear mongering that's going on, and these things may not come to fruition, or it could be even worse than what's being projected. So why not take the opportunity to educate ourselves, make sure we're protecting the city and the county in the meantime, and then once this very short 12-month period is up, we can make a decision based on what is good for economic development, what makes sense, and what is going to possibly protect our city and county.
So are you asking for us to join in with the county as a moratorium?
Well, I'm asking for us, if they, I would imagine.
My concern is I don't want to affect anything that's already in the works that we know is not one of those things. But if there's no clear definition of what a data center is, then maybe we're jumping in on that and causing that to halt.
Well, I think so.
That's why I was going with like trying to find, you know, a spot. If it's more than 50,000 square feet, if it uses more than X gallons of water per day, if it.
Let's take action on what we know.
Right, but I agree with that approach, but that's going to take time.
No,
right?
and
So I
understood,
think that
yeah.
In the meantime, we do join in with the county in this initiative so that we can research it, educate ourselves, and implement. And it's a perfect time to do it, right? Because we're updating our land development code now.
What about until we have that brought back to update our land development code appropriately?
I think that's fine.
If we can get that done in, say, 6 months or 5 months, then we don't need the year. Does that make sense?
So the direction with staff to be research the governor also signed that bill for the hyperscale. You and I both already picked up on what that entails, right? Councilman?
Did it pass?
That's the
Did it pass?
big.
Well,
I don't think it passed.
a lot of them are like,
Yeah.
you know, if you're using just general terms like over 1 million square feet and using 100 megawatts of power and using 500 gallons of
We don't even have
500,000.
room for anything like that.
No, correct. And what we have here is not that. It's a cable landing station. It's very small. It's 30,000 square feet. You're talking about these hyperscales are 1 million square feet plus, so 30,000 square feet
But if
versus
the
that.
westward expansion comes to fruition, there would be.
No, 100%. I do have concerns about that. Like, for instance, you know, if it were added to that industrial complex and now all of a sudden it requires massive amounts of water and things like that. So what we have is not that, but I want to make sure that we are proactively making sure that we're defining it in our land development code and making sure that the scary versions of this require absolute review and approval by the council as a not by right use. So you don't get to say this is my entitlement and I can do it. You have to come ask us for permission to do it.
I support that. That's taking action. Yeah.
Everybody supports that? Yeah. So the staff has their guidance. We got to figure out what the scales are and what the pool for water and electricity and all that. I sent some stuff to Marcus already based on some research, but it's everywhere now. So there's so much information.
Did you use ChatGPT?
The issue with AI, even finding out about AI, is, and we've had this conversation. I forgot who I had I think I had it with Chief Berryhill. AI is like, I was a fire direction officer in the artillery, and we use fire direction computers.
I already know what you're
Calculating
gonna say.
trajectory, deflection, all that stuff. And you have these things, you got big met, you got little met. But in fire direction systems, you can put in all the information you want, but garbage in is garbage out.
There it is, yep.
Garbage in is garbage out. And even some of the AI stuff I've used, I'm like, no, that's not right.
I've asked it simple questions about like certain things like tax rates in other counties and whatever, and it's like, here's the 62 counties in Florida. And I'm like, no, there's 67. It's like, you're absolutely right, I'm sorry. Here's the 63 counties. And I'm like,
But the dangerous part is it learns as it goes. So we're going to have, what is it?
Those other
Terminator?
steps beyond what we're
SwearNet?
talking about,
Not
yeah.
SwearNet. SwearNet's good.
I know you're talking about though. Yeah.
Skynet.
Skynet. SwearNet's totally something else.
Okay.
We already passed that.
Don't look it up.
Any,
I have,
So just direction on what you guys want staff and myself to do. It looks like you want me to define what a data center is and certain elements that meets a data center. I
Yes.
need a little more specifics than that.
the scale up to hyperscale. We know what hyperscale is, but what falls below hyperscale for regional areas is maybe something.
Well, I think my intent would be not necessarily even up to hyperscale, but anything that's causing a undue negative, in terms of water, power, those things.
Impact on our community.
Right.
Yeah.
And, that to include proximity to residential and schools. There's multiple things that you can do.
I still would encourage we prevent the approval of new data centers while this research is going on. So-
Until we get the land development code approved.
I support that.
Yeah.
Yes.
So you got what you need, Marcus?
Yeah, I'll figure it out.
Kind of, sort of, in a way? You ballpark it? Okay.
Give it a
You're
shot.
gonna have to bring it back to us anyways.
Vice Mayor has one more. What you got?
Yes, one more. So,
Oh, I wasn't,
we have-
no, I'm just
Are you
kidding.
done? Thank you for ceding me the floor. So we've had a couple really big animal cases in the community in the last few months, unfortunately, and they've been pretty devastating. And I want to commend our sheriff's office for a really good job in working with some of our community agencies and making sure that these folks are arrested and that this cannot happen in our community because it's it's very devastating seeing these animals. I also want to commend our animal control because they worked really hard in conjunction with Flagler County Sheriff's Office. And then I have to commend SMART. And this is where I'm going with this. SMART is, as you all know, the animal rescue 501c3 nonprofit in our community. And they do so much work for the animals in our community because the Flagler Humane Society only has a certain bandwidth. They can only do so many things. Animal control can only do so many things. But with these two large cases in the last few months, SMART has just been overwhelmed. I mean, to see the work that they've done, the hours, they've been working, thank God, for East Coast Animal Hospital because they get a ton of help from them to care for these animals. These animals are in terrible, terrible condition. So if it weren't for SMART and it weren't for East Coast Animal Hospital, a lot of these animals would have to be put down. They just would. We would not have the capacity to take care of them. I don't even know where they'd be. I don't know what would happen to them. I would like consensus from council to have staff look into us being able to enter into a contract with SMART to see if there's something that we can do similar to the contract we have with the Flagler Humane Society, because this is obviously not malintentioned, but we are taking advantage of SMART at this point. We just are. They survive on donations alone, but I can tell you right now there are not enough donations for them to be taking on what they're taking on and having to pay, even though East Coast Animal Hospital does do a lot for them at discounted rates and probably a lot for free, they still do have to pay for those services. And it is just not enough, particularly lately. I don't know what, we can do legally, but, the Humane Society is a nonprofit. I don't know why we couldn't enter into something with SMART that is similar to that. They're both nonprofits. But I don't believe we've looked into it in the past. So I would just like consensus from council to have staff look into it.
I agree. And echo everything you said about SMART and East Coast Animal Hospital, the Tajmares. are fantastic people that really help out the community as well as all the staff there. I was there getting my puppy's shots a week or two ago, and Caroline rolled up with 8 dogs, and I helped carry some. She put me to work, had me carrying some kennels and stuff through the side door. I was like, I just wanted to show you my puppies, but but they had a carousel of these rescue dogs from one of those incidents that you were mentioning, going through to get all their workup and shots and everything that they needed from the vet there. So they all do a great job. I support it. I think that anything that we can do to take some of the pressure, just like our pursuit of an animal shelter, municipal or county or combined, anything we can do to kind of take some pressure off FHS so they can be more efficient and pointed to the things that they're good at, and then also help out some of these people that are taking a large portion of the work as well. That it's only fair, right? If we're going to pay like a per animal rate to FHS, and SMART is doing the same thing without the contract, I think it's fair that they receive some form of compensation similar, so that they can continue. Otherwise, if they can't continue, then it's just going to drop more of that onto FHS and create a situation that nobody wins.
I have no problem with it. Miss Caroline does
Could I
great work.
wasn't going to say anything else, but just a thought. Remember when we decided to buy the temporary buildings for the utility department administrative offices, the thought that maybe in the future they could be used for part of the shelter? That still is possible. Nothing has happened to.
Got to get the mock finished first.
No, all we
The
got.
old building is gone. They're getting ready to put in the new ones, right? The temporaries, they're going to put them in.
Yeah, I've driven by a couple times and they're gone.
We're buying them, right?
Yeah, we bought them.
We bought them, and they may have a future use.
Could be.
Yeah.
And hasn't been signed into law yet, but we did get a little bit of help from the state.
Well, yeah, I was just going to touch on that. I was going to say thanks to Representative Greco and Senator Tom Leake. They fought for us again, and 2 years in a row they've delivered for us. And one of the projects on there was, the
Don't jinx it. Don't jinx it.
I got it.
I hope the governor is
All
not
right.
against dogs, right?
well, they fought for us is my point, and I just wanted to just recognize them and say thank you.
All right, thank you. Anything else, Vice Mayor? Okay. All right, today is National Bubba Day. And just throw a shout out to my two Bubbas, Christian and Sean. Christian was promoted last week to lieutenant, so he's a lieutenant now in the Navy. And Sean is entering his last year at FSU, and he's got another leadership position with the Florida State Seminole Marching Chiefs. So, and last thing, I love those boys. They're my heart. We are in hurricane season now. So if you can, for all residents, get the alert flagler, follow the Emergency Management Operations Center over at the county, because they are the coordinating authority during all natural disasters here in the county, working through our city. And Chief Berryhill is typically our what is it called? Incident commander. There you go. I got it. I knew my whole emergency management days. Incident commander. So make sure you're prepared. Get prepared for hurricane season. I don't know how active of a season it's going to be, but that's all I have. Anything else from the council?
I'll be at the State Emergency Management Conference this week as well, on behalf of the city.
Oh, I'm sorry. I do have one thing. Happy, though. It's a good thing. It's a good thing. So I'm doing a fundraiser on June 10th for the Family Life Center. It's at Red Clover in the European Village. It's karaoke for a cause. I want to see council members and commissioners out singing for the Family Life Center. It's only $10. You can come. I'm going to sing. So, yeah. So if anybody wants to see me sound horrible, not on the dais, you're welcome to come out, and I will allow video and picture of me singing for a good cause. So I can't wait for that. But no, seriously, we're going to have raffles, silent auction. They're going to do, Red Clover has been very gracious. They're going to do food and drink specials for us. So it'll be a really good time, and it's for a really good cause. So I'll be doing a shout out again on Tuesday. But I wanted to, you can get tickets online. If you look up my Facebook, I've got all kinds of stuff on my Facebook for it, so I hope to see everybody there.
June 10th.
June 10th.
Yes, ma'am. Mr. Attorney Man,
Nothing for me, sir.
Mr. City Manager.
Just a few things, sir. So there's a rack card on the cable landing station in the brochure rack by the agenda. So that has a lot of really good factual information about the cable landing station versus the data center. Also, Mr. Mayo and Mr. DeRiso from tonight have already made contact with staff and work on their particular issues that they brought up to us. And as well, just as an update out of Director Zobler's shop, we have had numerous written correspondence with Mr. Davis and working with have answered a number of his particular questions, and have also taken his advice and done some plan improvements on some good ideas that he has brought up. So just wanted to share that with council as well. Thank you.
Anything else? Any alibis?